different schools we start, with a single name in our part, to outshine the rest, with a great mind and compassionate heart. Oh, the trained us to be the best we can be. All that we learned at Top Rock Review Academy, we shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that if you want the Top Rock Review Academy. Soar to the sky. Of different schools we start, with a single name in our part. The clash of battle is sweet to hear right now, and the victory is near. Excellence is our only standard, to outshine the rest, with a great mind and compassionate heart. Trained us to be the best we can be. All that at Top Rock Review Academy, we shout soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that if you want the Top Rock Review Academy. Soar to of different schools we start, with a single name in our part. The clash of battle the best we can be. Soar to the sky. We learn that if you want the Top Rock Review Academy. Soar to the sky. Of different schools we start, with a single name in our part. The clash of battle is sweet to hear right now, and the victory is near. Excellence is our only standard, to outshine the rest, with a great mind and compassionate heart. Oh, the trained us to be the best we can be. All that we learned at Top Rock Review Academy, we shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the to the sky. We're there if you want to if you can soar to the sky.
Okay. Good afternoon, everyone. Hello. Ayan, naririnig niyo po ako? Kita niyo po yung screen ko, guys. Okay tayo? Okay. Kayo rin ba? 7 nag-start yung araw niyo? Because same. Charot. Nakakaloka. So apparently, we're given a time slot of 2 to 8 p.m. So if you would notice, medyo pangit yung pagkakahati nung time slot. So that's 6 hours of pure lecture. Wala po tayong maibibigay na dinner break. So didire-diretsuhin po natin until 8 p.m. So yung first afternoon break natin would be more or less on around 2:30 p.m. Okay, so that's 2:30 p.m., 15 minutes break. Tapos another break kapag na lang po na-oversaturate na yung brain cells natin. So again, my name is JD Rojas po. I'll be your lecturer for this afternoon. We're going to talk about your pre-intensive phase exam ratio. Kung mapapansin natin, guys, medyo mahirap siya, right? Medyo mahirap po yung material natin, pero we're going to study this material as carefully as possible para alam natin kung paano ba natin mas masasagutan ng tama yung mga ganitong klaseng test questions. Okay? So ganun pa rin, if you have any questions or clarifications, please feel free to tell me or ask me para masasagutan natin as a class because one brain is better than rather 288 brains is better than one brain. Ayan, i-discuss natin siya. If ever na medyo hindi naman tayo sure sa question na ibibigay niyo po sa akin, ay ipapark natin, tapos babalikan ko po kayo doon. Okay? Pakisabihan po ako if masyado po ako mabilis or mabagal, or if masyado po malakas yung boses ko or masyado namang mahina, kasi i-adjust po natin. Okay? Sige guys, pwede po bang pa-type na ready na so alam kong nandyan na po tayo. Ayan. Guys, huwag niyo ko iwan Huwag niyo ko iwan. Huwag po kayong sumama sa liwanag mamaya. Okay, sama-sama tayo dito. Tapusin natin to. Ayan. Tsaka chill lang tayo. Chill lang tayo. Because the more we chill, the more we can answer the questions better. Alright, so, I guess tapos na po yung first half nung exam material. So natapos na po ang NP1 to NP3. I'll be talking about your NP3 number 51 to 100, then NP4, then NP5. Okay. So paki-ready po ng material NP3 number 51 para same page po tayo. Yan. Number 51, guys. Ito na naman tayo. Okay. A nurse should instruct a premenopausal woman to examine her breasts according to which of the following schedules? Diyos ko, di ba? NP3, NP4, supposedly med-surg heavy concepts yan. Pero 51, OB-pedia pa rin. Okay? So, ganun pa rin. If you would notice, ang NP1, that's heavily concentrated CHN, CD. NP2, OB-pedia. NP3, med-surg. NP4 as well. Then NP5, dapat, ano yan, tawag dito, psych heavy concepts. Pero you would also want to prepare yourself na maka-encounter ng different types of questions all around your NPs or across all your NP exams. So, pag sinabi mo, ay, buti na lang NP3 na, wala na UB, wala nang pedya, wala nang CHN, wag po ganong mag-isip. Kasi, paano kapag may lumabas na UB, NP3, di na caught off guard ka? Na-panic ka tuloy. So, dapat prepare yourself for the following questions, whether or not kahit anong NP pa yan. Okay, accept natin sila as is. So this one, ang pinaka-focus po ng question would be about your premenopausal woman. So i-highlight natin yan. When I say highlight, guys, sa notes po ninyo, okay, bilugan niyo po siya or underline or lagyan niyo ng puso or ng pangalan ng crush niyo. Kayo po yung bahala. Okay, gusto ko lang na i-highlight natin para malalaman natin, matatandaan natin na ito yung focus ng tanong. About the premenopausal woman at the same time, breast self-examination. Ayan, highlight natin yan. Okay, the best answer is letter C, 7 days after the menstrual period. Bakit po? Ayaw natin na before the menstrual period. Bakit? Andyan tayo yung hormonal affectations niyan. Ano pa? Itong letter dog, on the same day, every month, mas okay to kapag postmenopausal na yung babae. Or kapag irregular, pwede rin on the same day every month. Okay, so 51, that's letter C. 51, letter C. Ito pong letter boy na every shower, napaka-frequent naman ito guys. Okay, napakadalas naman yan. So palitan natin, supposedly monthly, pwede na yan. Okay, monthly pwede na. Okay, ayan. Letter apple, hindi, X yan. Yan, so 51, that's letter cat. 51 is letter cat. Number 52, a nurse is taking the history from a patient who is suspected of having Hodgkin's disease. You're going to talk about more about Hodgkin's disease when you reach your oncology concepts. So hopefully, as you come across your intensive phase, mas mapag-usapan siya intensively. Okay, so suffice you to say guys, kapag Hodgkin's disease, that's a type of cancer wherein ang pinaka-affected po yung lymph nodes natin. So which of the following questions should the nurse ask to support the diagnosis? That's letter apple. They wake up sweating during the night. Okay, ito pong tanong na ito or assessment question na to assesses your presence of these symptoms. Okay, and when you say B symptoms, if you would read more about our references here in Hodgkin's disease, hindi naman siya exclusively found. Okay, sa Hodgkin's disease, pwede nyo rin po itong mabasa or ma-encounter. For example, kapag tuberculosis, yung pinag-uusapan nyo, mababanggit din yung B symptoms. And when you say B symptoms, anong meron tayo dyan? Nilalagnat yung pasyente. Ano pa? Nanghihina yung pasyente. Body malaise or body weakness. Ano pa po? Night sweats. Yun yung letter apple. Okay, so 52 letter apple. Ito namang letter boy, cat, and dog, hindi naman siya masyadong associated sa Hodgkin's disease, so X yan. Okay, so 52 apple. 52, that's letter apple, guys. 53, a nurse is observed taking all of the following actions when suctioning a patient who has a newly placed tracheostomy tube. Which of the following actions require intervention? Okay, medyo marami-rami tayong i-highlight dito. Okay, first one, highlight the word suctioning a patient. Ay, sorry po. Paano ko na siya sasabihin? Ayan, wait lang. Ano ba itong nangyari? Ayun. Ano pa po? Newly placed tracheostomy tube. Ano pa? Yung actual question sa'yo, i-highlight mo yan. Requires intervention. Pag ito po yung tanungan, which of the following actions require intervention, ibig sabihin, yung nurse na ino-observe mo, ito siya, di ba nag-observe ka daw ng nurse, may maling ginagawa. Asan daw yun dito sa choices? Okay, that's letter dog, deflating the tracheostomy cuff for 3 minutes before initiating suction. Guys, nagbigay pa siya ng time, 3 minutes lang naman eh. Okay, mali pa rin po because as you would, alin? Ah, sorry. So pre-intensive pa rin ba to? Guys? So bilisan na natin. Bilisan na natin. So daanan ka lang. Okay, sige, sige. Sabi niyo yan Sabi niyo yan. Okay, sige. So 53, the best answer is dog. Ganun lang. Ganun yung role ko dito. Okay. 53, the best answer is dog. Deflating the trach cuff for 3 minutes before initiating suction. Because the rest of the choices, tama naman yan. Okay, number 54, which of the following criteria would be a reliable indicator of improvement in a patient who has a diagnosis of anorexia nervosa? Okay, recap lang guys, anorexia is different from your anorexia nervosa. Kapag sinabi mo anorexia, lack of appetite yun. Symptom yun. Okay, kapag sinabi mo anorexia nervosa, that is an actual psychological medical condition. That's letter apple, electrolyte balance. Bakit? Ano bang tendency ng mga patients with anorexia nervosa? They would tend to starve themselves. So, syempre, kulang yung nutrition, kulang na rin yung electrolytes available. So, kapag nag-i-improve tayo, nagre-refeed tayo sa patients with anorexia, okay, expect mo, mag-i-improve din yung electrolyte balance natin. 54 apple. 55, a nurse evaluates a 3-month-old developmentally delayed infant for manifestations of cerebral palsy. Which of the following findings would a nurse report? Okay, so i-highlight mo to, 3-month-old infant. Highlight mo rin to, cerebral palsy. And then, report mo to kasi ibig sabihin, sa cause of your concern, possibly complications. So, refer mo na siya sa doctor. Apple, exaggerated arcing of the back. Okay, 55, apple. 56, to which of the following nursing diagnosis should a nurse give priority in the care of a patient who is receiving chemotherapy for treatment of breast cancer? That's letter apple, risk for infection. Okay. When a patient is undergoing chemotherapy, we know na kahit yung mga fastest, okay, lead dividing cells, affected din yan. For example, yung hair natin. Okay, so affected yung hair, so nagkakaroon tayo ng hair loss. Ano pa? Blood components. Okay, so yung blood components natin, fastestly dividing. Okay, therefore, affected din yung, magkakaroon yung patient na anemia, okay, thrombocytopenia, tapos neutropenia. So risk for infection. 56, apple. 57, which of the following conditions reported to a nurse by a 20-year-old male patient would indicate a risk for development of testicular cancer. Guys, pag binibigyan kayo ng age, okay, i-highlight mo na yan agad because it tells something. Ano pa? Testicular cancer. If you would notice, so kanina natin masasabi na commonly appearing yung testicular cancer, young adults na male. First, letter boy, undescended testicles. 57, boy. 58. Which of the following criteria would indicate improvement in an outpatient who has anorexia nervosa? That's letter apple. The patient identifies the relationship between emotions and eating behaviors. Okay. Actually, that's our goal to the majority or to every psych patient that we have for them to develop the insight. Okay. Because when you have that insight, halos related na silang lahat. Yung coping mechanisms nandyan, yung improved behavior nandyan. Okay, so 58, letter apple. 59. 10-year-old boy who is in terminal stages of Duchenne muscular dystrophy is being cared for at home. Highlight. Ano pa? Terminal stage ng Duchenne muscular dystrophy. When evaluating a major complication of this disease, a nurse would give priority to assessing which of the following body systems. Letter C, respiratory. In a general sense, kapag sinabi mong Duchenne muscular dystrophy, di ba? Muscular system yung affected. At the same time, alam natin na affected din yung respiratory muscles natin. So respiratory failure tayo dyan. 59, letter C. 60, the parent of a 12-year-old child who is on aspirin for juvenile rheumatoid arthritis tells a nurse, I just read an article that said aspirin should not be given to children. Which of the following responses by the nurse is appropriate? So highlight this one. Highlight aspirin. What else? Highlight juvenile rheumatoid arthritis. Tapos, syempre, yung cues mo na subjective cue, i-highlight mo rin. Okay, that's letter dog. The benefits of aspirin for your child outweighs the risk. In fact, guys, aspirin is one of the major medication for patients with juvenile rheumatoid arthritis. Ang rheumatoid arthritis, autoimmune yan, guys. Kailangan natin na anti-inflammatory drug. Okay? And according to studies, the benefits of aspirin naman would outweigh the cons or the risks. So, okay lang yan. 60, letter dog. 61. In the entry phase of community organizing, all but one of the activities a community health nurse shall implement. Highlight mo to, entry phase. What else? Highlight mo to, all but one. Pag sinabi mo all but one, para siyang kapatid ng word na except. So, aka except. Okay? So, ano hahanapin mo? Yung naiiba, yung mali. That's letter boy, project management. 62. Identification of potential leaders is crucial during the entry phase. This will facilitate the core group formation and start community mobilization. Which of these characteristics may not be necessary to an efficient and effective community leader? Okay, please highlight the word not. Pakibaboy po, okay, sa notes ninyo. Bakit? Because 3 letters lang yan, pero napakabilis makalimutan ng mga students. So, sayang yung point. Alam mo yung sagot sana, okay, pero nakalimutan mo na, uy, may not. Kaya din na mali ka tuloy. Tapos, lagay mo sa tabi negative sign. That's letter dog. College graduate who has good management and leadership skills. In fact, parang bihira naman tayong nagkaroon or ng encounter na college graduate tapos naging in touch sa community. 'Di ba? Hindi naman yun yung sukatan. Degrees, hindi naman yung sukatan. Gusto natin yung may pakialam. Okay, so community. So 62, letter dog. 63, the best way in identifying potential community leader, which is proven to be effective, that's letter boy. During group meetings and other small mobilization, observe people who actively motivates other residents. 64. The core group is composed of individuals in the community who possess leadership potentials, organized into cohesive working unit. The core group works with a team, in letter dog, mobilize the members to recognize and act on the immediate felt need, and participate in the delivery of essential help to all members of the community. 64, letter dog. Hindi lahat sa mga pagkakataon, tama yung ginagawa natin kung ano yung pinakamahaba, yun yung sagot. Guys, huwag kayong ma-fall sa ganong technique, hindi totoo yun. You still have to analyze the choices. Okay, so 64, that's letter dog. 63, letter boy. 64 dog, 63 boy, 65. The nurse as a community health practitioner functions as a community letter apple facilitator. Community facilitator. You're just there to guide them. Okay? Pero yung decisions, yung idea, sila gagawa nun. 65, letter apple. Anong lecture nyo kanina umaga? May lecture kayo kanina umaga? Kasi kahapon pala yung pre-intensive. Algeria. Okay. Sige. So 66 onwards, hindi siya naulit. Sterilization is the process of removing all living microorganisms. To be free of all living organisms is sterility, di ba? Binaligtad niyo lang yung statement, guys. For the sake lang na may masabi. Ganon. 66, there are 3 general types of sterilization used in the hospital, which is not included. Okay. If you want to learn more about your peri-op nursing concepts, ang reference natin would be the med-surg references natin, Brunner, Saunders, pwede rin. Okay, which is not included. Take note of the word not. That's letter dog, sterilization by boiling. Boiling, not a part of your sterilization process. Disinfection yan. 66, letter dog. 66, that dog. 67, autoclave on steam under pressure is the most common method of sterilization in the hospital. The nurse knows that the temperature and time is set to the optimum level to destroy not only the microorganism but also the spores. Which of the following is the ideal setting of the autoclave machine? Ang gloves ba, pwede kong i-autoclave? Ginamit ko na yung gloves, tapos in-autoclave ko. Wala na ba? Huwag ganon, okay? Single loose lang talaga yan. Okay? So, ang ideal setting natin would be letter dog, 121 Celsius for 15 minutes. Okay? If you would notice, makaka-encounter kayo ng mga types of questions na kapag hindi mo siya nabasa, pag hindi siya nadaanan ng mata mo, hindi mo na alam yung sagot. I call it the technical questions that we have. That either you know it or you don't. So all the more that I would like to remind and encourage you guys that if you have more time or extra time, please read more. Because the more you read, the more you know. The more information na may stock, di ba? Kapag actual board exam na, marami kayong sources, marami kayong references na easily retrievable lang. Okay, 67, that's letter dog. 68. It is important that before a nurse prepares the material to be sterilized, a chemical indicator strip, preferably a muslin sheet, should be placed above the package. What is the color of the stripe or strip? Stripe which produced after autoclaving, that's letter apple, black. Yun yung parang naka-micropore tape, tapos may black na stripes, 68, letter apple. Ibig sabihin, it underwent the sterilization process. 68, letter apple. 68, that's letter apple. Number 69, chemical indicators communicate that, letter boy, the items have undergone sterilization process but not necessarily sterile. 69, that's letter boy. I see. Okay, it's okay. All right, sige. So 69, that's letter boy. Number 70, if a nurse will sterilize a heat and moisture label instruments, it is according to AORN recommendation to use which of the methods of sterilization? Letter boy, autoclaving. Actually, pwede mo 'to masugutan kahit hindi ka masyadong sure na autoclave yung sagot. Kasi balikan mo lang yung questions. Anong pinag-uusapan natin dito? Okay, nababanggit na yung autoclave na concept. And more often than not, sa isang situation, pansin nyo, i-highlight ko to. Okay, sa isa pong situation, composed of 1 to 5 items or 1 to 10 items even, yung concepts na itatanong sa atin is halos closely related lang. Kumbaga, kung hindi mo alam yung isang sagot sa isang item, okay, skip mo muna, knowing na related sila. So kapag, pare autoclave itong 67, tapos autoclave din yung pinag-uusapan natin, okay, malamang sa malamang, autoclave din yung pinag-uusapan sa isang item, which is letter boy, 70 letter boy. So parang wag ka nang lalayo sa pinag-uusapan doon sa concept na binigay niya sa'yo. Parang ganon. 70, that's letter boy. 71, nurses hold a variety of roles when providing care to a peri-op patient. Number 71. Ganun pa rin. Gusto ko lang din i-share yung importance ng pagbabasa ng mga situation. Bakit? Kasi it prepares you to the following questions ahead para hindi ka ma-overwhelm na, uy, ano ba yung pinag-uusapan? Binigay na po sa inyo, peri-operative ang concepts. Okay? 71, which the following role would be the responsibility of the scrub nurse. Ayan, highlight natin ito, responsibility of the scrub nurse. Okay? Tapos, alam natin, letter C yung sagot. Account for the number of sponges, needle supplies, used during the surgical procedure. Kung mapapansin natin, binigyan tayo ng specific type of question. Ano ang role ng scrub nurse among the other healthcare team? So dapat yung titingnan mo po sa choices as specific as possible. Because if you would notice, letter apple, readiness of the client prior to surgery, I think any members of the healthcare team, for example, nurse can do that. The doctors can even do that. Okay? Letter boy, medyo vague yung sagot. Okay, ganun din yung letter dog. Itong letter dog, hindi mo to gagawin kasi anesthesia ka, girl. Anesthesiologist ka, girl. Okay, so 71, the best answer is letter C. Specific rule na scrub nurse, 71 letter C. 71 letter C, 72, as a peri-operative nurse, how can you best meet the safety need of the client after administering a pre-operative narcotic? Okay, sige. Highlight mo to, safety need. Yan. Tapos ano pa, highlight mo rin ito, after administering pre-op narcotic. Tapos guys, makikita natin sa choices, two opposing choices. We have letter apple, put side rails up and ask the client not to get out of bed. Ano pa? We have letter C, assist client to get up to go to the comfort room. Kita nyo yon? Opposing sila, right? Yung isa gusto mong paglakarin, letter C. Yung isa gusto mong bed rest lang. Okay? And as we know, guys, two opposing choices required two opposing choices, isa sa kanila yung tamang sagot. Yan. Two opposing choices, isa sa kanila yung tamang sagot. So the first thing that you would do is to acknowledge na meron tayong two opposing choices. Ginawa na natin, letter A and C. What's the next thing that we should do? Burahin mo na sa paningin mo yung mga choices na hindi naman kasali. Yung hindi naman kasali kasama sa opposing choices na binabanggit natin. So yung letter boy, yung letter dog, burahin mo na yun sa paningin mo kasi magugula ka lang lagi. Okay, so 50-50% chance na lang yan. Paglalakarin mo or hindi mo paglalakarin. Of course, sabi daw safety need. Ano ba yung side effects ng mga narcotics na binibigay natin? Hypotension could be one. Right? So 72 letter apple. Bed rest lang yan. Pag pinaglakad mo yan, tas na hilo-hilo si ate girl na pasyente, edi bumagsak pa siya. 72 letter apple. 72, that's apple. 73, it is the responsibility of the pre-op nurse to do skin prep for patients undergoing surgery. If hair at the operative site is not shaved, what should be done to make suturing easy and lessen the chance of incision infection? Letter C, clip mo lang siya. Okay, 73, letter C. I-clip lang po. 74. It is also the nurse's function to determine when infection has developed in the surgical incision. The perioperative nurse should observe for what signs of impending infection. Guys, dapat medyo i-brush up niyo rin yung vocabulary ninyo kasi yan nga, magbibigay sila ng parang words na parang doon pa kayo madadali. Alam niyo sana yung nursing concept pero hindi niyo alam ano yung impending, mga ganon. Okay, so i-highlight natin to, impending infection. When you say impending, magkakaroon pa lang. Okay, magiging full-blown infection pa lang siya. Parang ganon. So that's letter apple. Localized heat and redness. Diba? Isa to sa mga hallmarks ng inflammation natin. Heat, redness, pain, swelling, ganyan. Itong letter boy, pansin natin, serous sanguineous exudates and skin blanching. May drainage na guys, may pus na guys. Okay? So ibig sabihin, super duper infection. Parang ganun. Okay? So hindi siya impending. Actual infection na yan. Letter C, separation of the incision. Ganun din, hindi rin siya impending. Actual infection. In fact, towards complication na nga yan eh. Itong letter dog, blood clots and scar tissue are visible. Ganun din. Burahin mo. 74, apple. 74, that's letter apple. 74 is letter apple. Number 75, which is the following nursing interventions is done when examining the incision wound and changing dressing. Anong sagot nyo dito, guys? Can I see your answers? Can I see your answers? O kunwari, hindi natin alam na letter apple pala yung sagot. Anong sagot nyo? A talaga? Baka lang kasi may nalito na iba. Yung iba kasi letter boy, yung iba letter cat. Which I acknowledge na nakakalito naman kasi talaga. Kasi parang pag binasa natin, parang lahat tama. Right? Pero the thing or the way to answer this one is to analyze the question properly. Ano yung mga words na ginamit when examining the incision wound and changing dressing? Ibig sabihin guys, nasa harap mo na yung sugat. Okay? Nasa harap mo na. Okay, so ibig sabihin tapos na yung patient consent, nagawa mo na yan, supposedly, nag-wash hands ka na rin. Itong letter dog, nauutusan mo yung client, wag mo namang gawin to, mami. At for the sake of participation, ganon. Okay, letter apple pa rin, i-assess mo na yan. When you say examining, it's more like assessment tayo. So assess mo, 75 apple. Ganon. Okay? '75 is apple. Number 76, situation. Ito rin, siguro kasi maraming ayaw magbasa ng situation katulad nito kasi napakahaba. Okay, pero practicein na natin guys as ideal as possible. Believe me, it is possible na ideal way tayo magsagot sa board exam. Okay, first way, okay, kalmahan lang natin. Relax lang tayo. Kasi when we relax, it's there. Kitang-kita natin yung sagot. Okay? Enrolling as nursing students taught you what the nursing profession has in store for you and to recognize that each one came from different environs, influence, past and present. Ganyan. As you journey through nursing, you saw yourselves transform from the person you were. Cue music, ganyan. Nagsisenti pala si ate sa situation. From the person you were to the aspiring nurse you have become. Ganon. Now that you have graduated and now taking your nurse licensure exam, there is only the you who is the nurse. Ang taray, di ba guys? Parang pwede mo siyang isulat sa Twitter bio mo. Me, who is the nurse. Parang ganon. Okay, 76. As an aspirant, a beginning nurse practitioner after your basic nursing education, the you who is a professional nurse means that's letter dog. The person I am and the professional nurse I aspire to be have now developed into one Filipino nurse. You are one and the same identity. 76, letter dog. Okay. I-compare natin siya sa ibang choices. Let's say, sabihin natin letter C. Okay? Or letter boy, or letter apple, pansin natin na mas general term kasi yung letter dog. Yung A, B, and C, pwede mo siyang isubsume. Pwede mo siyang sa answer ng letter dog, right? So 76 dog, best answer yan. 76, that's letter dog. 77, as you progress in developing your nursing competencies. More hugot ho. You have to thread. Si Catriona, not one but as 4 million Filipinos. Ganon. You have to thread a career path according to the culture and design of Philippine nursing. This means, okay, sige, ayan. Highlight natin ito. Philippine nursing, guys, to emphasize. That's letter C, avoiding personal and professional stagnation by updating and upgrading one's self. Guys, as we know, okay, nursing profession is a very dynamic profession. And when you say dynamic profession, guys, it's ever changes, okay? Basta meron tayong lumabas na bagong journals or articles or researches, mag-iiba na rin yan. Let's say yung nursing diagnosis natin or interventions that we have. So ang sinasabi ng question na ito, guys, kung dynamic ang nursing profession per se, dapat yung nurse din mismo dynamic, dapat siya rin ever-changing, ganon. Dapat siya rin nakikisabay sa change. That's letter C. Okay? If you want to answer letter dog through advanced technological means and strategies, parang tunog tama siya. Okay? Pero parang nakukulangan ako kasi bakit siya limited sa technological means lang? Diba? If you want to answer letter boy, progressing as a nurse generalist, in a multitude of that expert nurse practitioner, parang wala naman tayong context na nurse generalist sa Philippine setting, right? Wala tayong ganito. So, hindi rin natin to isasagot. So, 77 letter C. Ganon. 77 letter C. One more, 77 letter C, 78. It is important to remember that while RNs value job tenure because the years in service spell variety of experiences in nursing practice, it is far more valuable to consider that tenure years are nothing. Guys, tenure years are nothing. This is really true if these are not parallel with one's personal professional growth and maturity. And this implies letter C, progressive upgrading of competencies in terms of knowledge, skills, and attitude, and values as a professional nurse. Alam mo, in all honesty, walang sugar coating to, guys. Talong-talo talaga ang mga nurses sa Pilipinas. Kahit sa hospital ka naman mag-apply, napakalugi natin as a nurse. Okay? But to tell you about the concept of tenure, for example, public tertiary hospital, makaka-receive ka ng tenure. When you say tenure kasi, kahit umalis ka, anytime, pwede ka nilang tanggapin pabalik kasi tenured ka doon, may position ka doon. Okay? For example, it will take you 3 years to achieve that tenure. Security of tenure. Yun yung sinasabi ng security of tenure. Okay? Eh kung hindi naman na-align yung values mo, yung personality mo doon sa ward where you belong or the hospital that you belong, aalis at aalis ka dyan. Yun yung sinasabi ng question natin. Okay? So 78 letter C. Kasi nga, sabi natin, we are a dynamic person as a nurse and as a professional. 78 letter C. 78 letter C. 78 letter cat, 79, we often give our best in caring best, but despite all efforts, the reality of facing that is inevitable. Ganon. Our brand and core values of nursing will always extend beyond the ordinary levels of promotive, preventive, curative, and rehabilitative care. These culturally bound Filipino values of nursing likewise needs to be nurtured. Okay. When we talk about your cultural values, okay, in a sense, in the context of your nursing care, that's letter dog, relational care, because, uy, wala, nagsasabi lang ako ng totoo, guys. Oo. Meron din, aminin na natin, 300 tayo dito, meron din mga students na gusto mag-abroad after. Tapos meron talagang magsasabi sa inyo na bakit ka mag-abroad, dapat dito ka muna. Okay? Sabihin nyo sa kanya, sa magsasabi sa inyo nun, guys, kung gusto nyo mag-abroad, you don't get to tell me where I would or where I should be. Kasi hindi naman black and white ang nursing profession eh. Diba? So parang if it's your decision, if that's what you want, okay lang. Wala namang kaso. Yung mga nurses who want to stay in the Philippines, go lang. Yung mga nurses na gusto mag-abroad, go lang din. Kasi iba-iba naman tayo ng situation eh. So you don't get to tell or you don't get to impose your ideas or values to other people. So yun yung gusto kong ituro sa inyo, guys. Huwag niyo hayaan na maniwala kayo sa mga sasabihin ng people because that's your life. You get to decide, guys. That's your license. Okay? Ganyan. So ito na nga. Balik na nga tayo. So relational care, okay? Parang sinasabi niyan, holistic care. Okay? Kasi pag sinabi mong holistic, lahat encompassing, including your cultural values. Ito yun, yung highlight natin. Okay? So 79 letter dog. 79, that's letter dog. Number 80. It is important to not only enrich one's mind with progressive technical upgrades, but equip oneself with holistic personal and professional development, believing that, that's letter C, we and the beneficiaries of our care are made up of body, soul, and spirit, and each component do have health needs intertwined. Ganun. 80 letters. 80, that's letter cat. Again, nagkataon lang na ito yung pinakamahabang sagot, guys. Kaya siya yung tama. 80, letter C. Number 81. Med-surge na tayo. A client with chronic renal failure has completed a hemodialysis treatment. A nurse would use which of the following standard indicators to evaluate the client's status after dialysis? Yon. So, highlight mo to. Chronic renal. Ay, sorry. Ayan. Highlight mo rin to. Hemodialysis treatment. Ayan. After dialysis daw, paano yung mga indicators natin? That's letter apple, vital signs and weight gain. Vital signs because expect natin na from hypertensive, medyo magno-normalize yung BP niyan. Or kung hindi man po mag-normalize, bumaba-baba kahit papano from your baseline. What else? Weight gain. Okay. Before hemodialysis, expect natin na medyo edematous pa si patient. Marami pa siyang fluid sa katawan. So after dialysis, you would want to expect na medyo mababawasan yung weight niya. Okay, so 81, letter apple. 81, that's letter apple. 81, that's letter apple. Number 82, a client with chronic renal failure, CRF, returns to the nursing unit after hemodialysis treatment. On assessment, the nurse notes that the client's temperature is 100.2 degrees Fahrenheit. Which of the following is the most appropriate nursing action? Letter boy, continue to monitor vital signs. And alam ko kayo guys, syempre hindi naman tayo masyadong familiar kapag Fahrenheit siya. So i-convert natin to Celsius. Yan. Okay. This one is 37.8. degrees Celsius. And kapag 37.8, a little bit higher than yung 37.5, but not really a cause of concern. Okay? Kasi, kunwari 37.5, 37.8, we would want to monitor the client more. Kapag yan ay tumungtong ng 38.7 or 38.9, ayun na yun, tipong mag-chills na si patient, baka complication na yun. But for now, tuloy mo lang yung monitoring. 82, letter boy. 82, that's letter boy. Okay, 82, that's letter boy. 83. Ay, ito pala to, guys. Okay, prepare ko sa inyo. I just borrowed this from Google. Baka lang kasi maitanong na naka-Fahrenheit, tas gusto natin ng naka-Celsius. Hindi madalas yung Fahrenheit sa board exam. But to help you better lang, for quicker reference, you may want to screenshot this one. Tapos i-memorize na lang din natin. Ano po yung temp na dapat i-report na si physician? 38.5 above. Or 38.5. Ay, sorry, 38 above. 38 above. Ayan. Carry? Okay. 38 above, pwede na. Next one. A nurse is reviewing a list of components for peritoneal dialysis solution with a client. The nurse asks the client the purpose of the glucose contained in the solution. So, i-highlight nyo po muna ito. Ayan. And then, highlight nyo rin ito. Purpose ng glucose. Yan na naman tayo, guys. Bakit? Okay, the nurse bases the response on the knowledge that the glucose, letter apple, increases osmotic pressure to produce ultrafiltration. Because as we know, guys, the more glucose na included sa isang solution, it makes that certain solution to be hypertonic. Yon, sulat ko lang. Wala lang, kasi para lang mas maintindihan nyo. Okay, so the more hypertonic the solution is, the more increased yung osmotic pressure niyan. And when you see osmotic pressure to produce your ultrafiltration, ibig sabihin, mas malakas na ngayon yung pagpupul niya ng excess fluids, which is what we want kapag nagda-dialysis tayo. So 83, letter apple. Okay. 83, that's letter apple. So the more hypertonic, the more increased osmotic pressure to produce your ultrafiltration. Ayan. Ganun. 83 apple. Minsan, lilituhin kayo ng BUN, i-mislead ka nila. For example, letter boy prevents disequilibrium syndrome. Maglalagay sila dyan ng mga words na related. Tapos mag-overthink ka na. Okay? Pero kasi kung alam mo guys yung hinahanap mo, pag alam mo kung ano hinahanap mo, hindi ka na magpapalito. When you say disequilibrium syndrome, ito po yung neurologic symptoms na napoproduce sa isang dialysis patient kasi masyadong mabilis. Okay, yung fluid shifting, masyadong mabilis yung natatanggal na BUN, hindi makakip up yung brain natin. Okay? So, ayan, disequilibrium syndrome, medyo hindi naman siya related kapag ito yung tinatanong glucose na purpose. Okay? Decreases the risk of peritonitis, infection, hindi rin naman siya ganun ka-related. So, 83, letter apple yan. 84, nurse is caring for an 88-year-old woman suspected of having urinary tract infection. Which of the following, if noted on a client, would alert the nurse for a possibility of UTI? Guys, please, in general, as a rule ko lang. Na-rule nyo na rin, guys. Yung rule ko, mga rule nyo na rin yan. Okay? Kapag binibigyan kayo ng 88-year-old, may mga naulit po na tanong sa actual board. I cannot speak for any seasons, pero sa experience ko po, wala. Hindi ko lang po sure sa ibang seasons ko meron. Okay? Parang wala pong naulit. Pero guys, if ever po na may naulit, ano po yung possible na technique na pwede kong ma-share sa inyo? Kung alam niyo po yung sagot doon sa tanong na naulit, i-secure mo na, mami. Okay? Same lang din yung isagot mo sa tanong na naulit. Pero kung hindi ka naman sure sa sagot doon sa tanong na maulit pa, ibahin mo yung sagot mo para may 50-50% chance na tama ka kesa naman 0% chance. For me lang yun And nire-recommend ko lang kayo. Okay? Ini-encourage ko lang kayo to do the same. Okay? Sige. So kapag po binibigyan kayo ng age ng patient, for example, 88-year-old woman, kapag binibigyan po kayo ng gender ng pasyente, let's say woman, hindi yan nandyan kasi trip niya lang. Okay, may purpose yan. It would lead you to the right answer. Sabi daw UTI. And as we know guys, napakarami pong physiologic changes ng elderly patients natin na hindi naman po pathologic. For example, decreased ang thirst mechanism ng mga elderly patients natin. So anong tendency nun? Hindi nila mafe-feel na nauuhaw sila, na thirsty sila. So anong tendency nun? Increased risk for them to be dehydrated. Right? Yung mga ganon. And in this context, UTI daw, tas elderly, that's letter C, confusion. Better way to tell us, okay? 84, letter C, confusion. Frequency, urgency, fever, hindi yan. Okay, so 84, that's letter C. Dapat age appropriate din yung mga sagot natin sa tinatanong nila. Okay, 84, that's letter C. 85, a nurse is caring for a client following kidney transplant. The client develops oliguria. Guys, what's oliguria? Increased UO or decreased? Increased, decreased. Wow, nagbigay pa ng amount. Si ma'am. Okay, so tama naman kayo. Decreased, okay? Kasi dito pa lang, i-define nyo na yung mga terms kasi mag-iiba yung sagot ninyo kapag mali yung definition ninyo. So ngayon, alam natin decreased urine output. Sulat lang natin dito, decreased urine output. Yan. Which of the following would the nurse anticipate to be prescribed in the treatment for oliguria? That's letter dog, administration of diuretics. Minsan, I have a patient, napakamanas niya. As in, para na siyang clown, para na siyang may costume. So, sobrang manas na manas niya na. Okay? And before we resort, we resort to dialysis as a management kasi medyo invasive ang dialysis. Dapat muna tayo, anasarca is the term, correct? Okay? Dapat conservative management po na tayo. Yan, okay? Furosemide number 1 tayo dyan. Yan yung mga favorite nating diuretics. Furosemide. Alam niyo ba ang furosemide, guys? Ganito lang siya kaliit na ampule. 2 milligrams lang. Meron naman mga makakapal, mga malalaking ampule. But then kasi minsan, kapag sinabi natin or kapag nag-order yung doktor na 80 milligrams na single dose stat dose, 120 milligrams stat dose. Okay, napakataas na yun guys because we would want to know kung after 2 hours ba iihi yung pasyente. Kasi napaka-oliguric niyan. Okay? So, ganun ng ganun. So, kapag magbigay ka na single dose na 80 milligrams furosemide, check mo yung urine output niya. Kung wala pa rin, refer to the doctor. Parang ganun siya. So, 85, letter dog. As comparing to your letter apple, forcing your fluids. Medyo big. Para anong klaseng fluids gusto mo? Per oren ba yan or IV? Di ba? Mas gusto ko yung letter dog. Mas specific siyang sagot. 85, letter dog. 85, letter dog. 86, client diagnosed of polycystic kidney disease. Which of the following would the nurse not expect to be a component of the treatment plan? Okay, kung makikita niyo guys yung word na not, nagsisigawan na siya guys. Sinisigaw niya na sa'yo, andito ako, ganyan. Okay, kasi nga, na-overlook yan minsan. But even still, i-highlight mo yan. Okay, that's letter dog, sodium restriction. Ang polycystic kidney disease, ang nature niyan would be magtatapon at matatapon siya ng sodium sa katawan. Okay? So therefore, anong gusto natin mangyari? Gusto natin na mas mag-increase ng sodium intake, water intake natin. Okay, so hindi kasama yung letter dog, sodium restriction. Dapat hayaan lang nating mag-intake siya ng mga sodium. Okay? Ano pa po? Patients with polycystic kidney disease, mga hypertensive yan. Over the roof ang BP niyan. So okay lang tayo na magbigay ng anti-hypertensive medications. Carry yan. Carry. Sulat na nga natin, carry. Increase water intake, carry. Okay lang. Genetic counseling, carry lang din. Bakit? Ang polycystic kidney disease, medyo may genetic affectations yan. Okay? So 86, letter dog. 86, letter dog. 87. A client with chronic renal failure who is scheduled for hemodialysis this morning is due to receive a daily dose of enalapril. Anong klaseng drug classification ng enalapril? Anong klaseng drug classification ng enalapril? Yes. ACE inhibitors. Correct. ACE inhibitor. With conviction, Ma'am Elaine. Okay, ACE inhibitor, exclamation point. Ganon. Okay, tama naman kayo. ACE inhibitor, anti-hypertensive medication. Yan. That's what we want. Ganon ka-confident. The nurse would plan to administer the medication, that's letter apple, upon return from dialysis. Okay, upon return from dialysis. Bakit? Kasi pag before dialysis mo siya binigay at nag-hypotensive yan during dialysis, mas complication yun. Mas mahirap kaya maghabol ng hypotensive kesa hypertensive. Mas mahirap i-treat yung hypo kesa hyper, right? Ano pa? Itong letter the day after the dialysis, parang nag-misdose ka na nito. During dialysis, hindi rin ito. Okay, so 87 letter apple. 87 letter apple. Ayan. 87 apple. 88, a nurse is reviewing the medication record of a client diagnosed with CRF or chronic renal failure. The nurse notes that the client is receiving aluminum hydroxide. Eto guys, pag narinig niyo yung aluminum hydroxide, anong klaseng body system ito usually may encounter? Di ba pharmaco to? Pharmacology, drugs. GIT, right? Alam natin na, GIT drug ito. The nurse plans care knowing that the purpose of this medication is to, pero meron din siyang effect sa patients natin with chronic renal failure. Ito po yun, letter apple. Combine phosphorus and help eliminate phosphates from the body. Guys, ano ang relationship ng phosphorus pati po ng calcium? Directly or inversely? Directly, inversely. Uy, ang gagaling naman nitong mga to. Walang nagkakamali. Okay. Ang galing naman ni Ma'am Aizel. Alam na alam. Correct po. Okay. Inversely proportional. Therefore, kapag ang pasyente natin merong hyperphosphatemia, i-expect natin na meron siyang hypocalcemia. And patients with hypocalcemia, medyo iba rin ang complication yan. Ayaw din natin mangyari yan. So, ang purpose na aluminum hydroxide, which would be given after the meals, okay, magbabind doon yung excess na phosphorus, tapos lalabas siya sa katawan. Okay, 88 letter apple. 88 letter apple. Yun din guys, kasi 'di ba nasabi natin GIT ang aluminum hydroxide. So baka ang focus ng tingin niyo naging letter boy at dog niya. Parang in the first place hindi niyo pinili yung letter apple. Pero wag niyo kakalimutan yung body system natin, chronic renal failure, kidneys dapat. Okay? So 88 letter apple. 88, that's letter apple. Number 89. Bakit wala tayong naka-answer dito? Okay, that's boy. A female client with chronic renal failure is receiving a hemodialysis treatment. After dialysis, Nurse Sarah knows that the client is most likely to experience, that's letter boy, weight loss. Weight loss because expect natin, okay, na yung mga sobrang fluids na tanggal na po after dialysis. 89 letter boy. 89, that's letter boy. Epoetin alpha or Epogen is prescribed for a client with chronic renal failure. The client asks the nurse about the purpose of the medication. I-highlight ko lang po ito. Ang Epoetin guys, if you're not familiar with it, para po siyang maliit siya na pre-made na siya, nai-inject natin subcutaneously sa pasyente. Minsan ng order niyan thrice a week or twice a week, depende po sa levels ng laboratory values ni patient. Okay, bakit daw po natin ito ibinibigay sa kanila? Letter boy, used to treat anemia. Bakit? I-stimulate niya po yung production ng erythropoietin natin sa katawan. Yes, correct. Ang gagaling, guys. 90 letter boy. Kailangan pa ba natin na explanation dito? Kailangan pa ba ako dito? Tanong ko lang. Or baka alam nyo na to. Ayan, 90 letter boy. Okay, 90 letter boy. 91. A client with renal failure is being managed by continuous ambulatory peritoneal dialysis or CAPD. Let me highlight that for you. Ayan. During outflow, the nurse notes that only half of the 2 liters dialysate has been returned and the flow has stopped. Anong problema? Assess muna which of the following interventions that the nurse should take to enhance the outflow. Tapos guys, alam mo dito pa lang kailangan mo nang mag-assess. Asan po dito sa choices yung kaisa-isang nag-a-assess siya? Di ba wala? Kasi interventions to lahat. Okay. I-assess natin, baka nag-kink lang or baka may obstruction. Okay, i-reposition natin yung client. Letter A is the answer. 91 apple. Nakakaloka. 91, that's apple. Okay? Gets nyo guys? Gets nyo? Bakit magre-reposition muna? Okay? Baka lang na-kink yung tube. May obstruction. Ganun. 91, apple. 92, the nurse is reviewing the client's records and notes that the physician has documented that the client has a renal disorder. On review of the laboratory results, the nurse most likely would expect to note which of the following: that's elevated BUN level. Kung creatinine ninyo nakasulat, okay lang din naman. Tama rin naman yan. 92, boy. 92, letter boy. 93, the client has been diagnosed to have acute renal failure. Highlight. He has been prescribed low protein, low potassium, and low sodium diet. A teaching program should include, that's letter boy, recommending protein of high biologic value, such as eggs, poultry, and lean meat. Guys, baka lang may magtatanong or magtataka. Bakit po letter boy yung sagot? Kasi low protein ang kailangan natin. Okay? Ano po ba ang purpose? Okay. 89 is letter boy. 89 boy. Ano po ba ang purpose ng protein sa katawan ng tao? Bakit kailangan natin yan kainin? First of all, of course, body mass. Okay. Second of all, kailangan natin ng essential amino acids. When you say essential amino acids, ito yung mga klase ng amino acids na hindi naman po nasisynthesize ng katawan mismo. So, saan natin sila kukunin? Sa mga pagkain po. And usually, yung mga pagkain na yun, mga protein sources. Okay? So, sabi dito, kung magre-recommend ka lang din naman ng low protein diet, okay, ibigay mo na yung mga protein na may high biologic value. When you say high biologic value, ito yung may mga matataas na amount ng essential amino acid. Okay? Meron din naman kasi tayong low biologic value. Okay? And when you say low biologic value, syempre kung mataas yung amount ng essential amino acid sa high, ito, medyo low lang din. low source ng essential amino acids. Okay? Ano yung mga examples nito? Kung yung high biologic value, mga poultry, eggs, meat, okay, ito po yung mga legumes, mga green, leafy vegetables, ganun. Ganyan. Okay? So I'm also trying to tell you guys that just because high biologic value doesn't really necessarily translate to high protein amount. Okay, hindi ganun yung pinag-uusapan natin. It's about the amount of your essential amino acids. 93 letter boy. 93, that's letter boy. 93 letter boy. One more. 93, that's letter boy. 94, the client undergoes peritoneal dialysis. Which of the following is least likely expected? Ayan. Least likely expected. That's letter dog. Blood transfusion is administered during peritoneal dialysis. 94 dog. 95. The client with a diagnosis of end-stage irreversible chronic renal failure has been scheduled for hemodialysis. She has AV fistula created in her left forearm. Can I take my BP there? Pwede ba ako mag-BP? Sa may AV fistula. Bawal. Okay. Pwede ba akong kumuha ng blood sample? Can I take my venipuncture there? Apparently, hindi rin. When you're working in a teaching hospital, guys, ibig sabihin, okay, maraming humahawak sa kanya. Interns, residents, basta maraming humandle sa kanya. Minsan, nakakalimutan na may AV fistula yung pasyente. So, anong tendency mo as a nurse? Ikaw na bahala dyan. Naglagay ka ng micropore dito, sabihin mo left arm precaution. Ibig sabihin, alam na nila yon, may AV fistula dyan, wag ka dyan. Okay, save left arm, mga ganyan. Correct. Sir Kim. Uy, hello. Hi. Okay, so that's letter dog. Ay, sabi daw dito, which of the following is not included? Ayan, not included. That's letter dog. Monitor urine and blood glucose levels. 95 dog. Itong ampogel natin, ito po yung aluminum hydroxide that we talked about earlier. Carry, 95, letter dog. Number 96, the physician orders exchange resin kayexalate to the client with chronic renal failure. The expected outcome of this medication is to lower serum potassium. So magbabind din yung excess na potassium dyan, ilalabas niya lang din. 96, letter apple. 96, that's letter apple. 97. The client had undergone hemodialysis for the first time. Ito na nga po yun, guys. Which of the following signs and symptoms indicate that he is experiencing disequilibrium syndrome? Okay. Think of your neurologic symptoms. Asan dyan yun sa choices? Letter apple, neurologic symptoms. Ibig sabihin, nahihirapan mag-keep up yung katawan sa fluid shifting na nangyayari. Nagugulat siya. Okay, 97, letter apple. 97, that's letter apple. Again, number 97, letter apple po. One more time, 97, that's letter apple. 98, patients with urolithiasis need to be encouraged to, that's letter boy po, strain all urine. Okay, strain all urine. When you say urolithiasis, sa madaling salita, it's about your kidney disease, kidney stones rather. Okay, kidney stones. So number 98, that's letter boy. Straining. Ayun, thank you po sa mga sumasagot ng mga answer para hindi na natin siya mababalikan. Thank you po. 98, it's letter boy. 99, patients. Wala namang patient na words. Ako nabasa yun. Which of the following medications would the client most likely receive after kidney transplantation? Okay, which of the following medications? So expect mo lahat ng nasa choices medications yan. Okay, ano pa? Highlight mo to. Kidney transplantation. Letter A po is the answer. Azathioprine or Imiran. Why strain the urine? Dito, balik tayo. May stones ang urine natin. So gusto nating i-strain yun for us to assess further. Kasi iba-iba yung kidney stones natin. Meron tayong calcium stones, meron tayong oxalate stones, para rin malaman natin kung ano ba yung management for that kind of kidney stones. Right? Again. Para rin ma-assess mo kung gaano karami yung stones na present sa bawat urine output ng pasyente. Mga ganon. So 98, that's letter boy. Ito po yung 98 boy. 99 is apple, imuran or azathioprin. Okay? Bakit kailangan natin ng imuran, guys? Okay? To avoid the body to reject the organ. Tama ba yung grammar ko? Basta parang ganon. Yes, to avoid the rejection of the transplanted organ. So, imuran tayo. 99 is apple. Immunosuppressant din yan. Yes, correct. Sir Limiel. Pwede rin po siya sa rheumatoid arthritis, in fact. Okay, so 99, that's letter apple. So, kailangan po bang lifetime ko na siya i-take after my kidney transplant? Apparently, yes. Okay, apparently, yes po. Number 100, which of the following conditions is a common cause of pre-renal acute renal failure, guys? Ngayon pa lang, alamin na natin yung mga shortcut sa buhay. Okay, kapag pre-renal acute failure, may mga keywords tayo dyan na one word lang. Talk about your, pag pre-renal, yung affectation yan before the kidney. Okay, so baka nagkakaroon ka ng decreased cardiac output, baka may MI si pasyente. Okay, kapag intrinsic naman, okay, ano yan, within the kidneys. So pag sinabi mong within the kidneys, yung kidney mismo yung may problema. Yes, correct. For example, nag-overdose ka ng mga nephrotoxic agents natin such as your chemo drugs, yung aminoglycosides natin, yung mga nephrotoxic agents natin na yan. Nephrotoxic agents, or merong specific structure sa loob ng kidney na yun yung may problema, ganon, intrinsic yan. Pag sinabi mo pong post-renal kidney failure, so syempre nasagot na yung before tsaka yung within, so after tayo, after kidneys. Usually, yung mga obstructions, dyan natin ipapasok yan. Tama po, Sir King. For example, tumor. Okay, yung mga stones. What else? BPH, benign prostatic hyperplasia, pwede rin natin yan. Okay, ang tinatanong ulit is pre-renal. Uy, kita natin decreased cardiac output. Nasa choices po siya. 100 letter boy. Questions? Paano po pag sinabing rhabdomyolysis o myo muscle lysis breakdown? For example, pwede mo rin ito ma-encounter kapag burns patient as a complication. Okay, nagbe-breakdown yung muscles. So napakaraming proteins na ilalabas sa bloodstream. So hindi maka-keep up yung kidney, nasisira siya. Ganon. Questions? Questions? Carry lang. Questions po. Are we clear? Hello? Hello? Ayan. Paramdam tayo, guys. Pakigalaw ng baso, guys. Okay lang ba kayo dyan? Okay lang tayo. Okay. So, tawid na tayo. NP4. Ayan. Pero bago tayo mag-NP4, mag-break muna tayo para maganda naman yung pasok natin. Mag-afternoon break muna tayo. 15 minutes. So, balik tayo by 3:35. Yan. Thank you, guys. Thank you. 3:35 po. Wag! Sir Clyde, dito ka lang. Sa tabi namin. Sama-sama tayo dito. method nung pag-teach mo po kanina, pag-start natin, i-employ na technique for NP4 and NP5. Paano yan? Which specifically, anong klase po yan? Pero ayan, so we're going to talk about your NP4 exam material. Okay. Pakisabihan po ako, ma'am, which specific method you want me to do para mas maano natin, mas magagamit natin. Okay, so number 1, NP4 situation, most hematologic disorders are relatively indolent, whereas others have severe consequences and can be life-threatening. A thorough understanding of the underlying processes associated with these disorders can assist nurses so they may appropriately assess, monitor, educate, and intervene with patients. Okay. Okay, so situation, it talks about your hema disorders. Highlight natin yan. Number 1, Facundo, 10-year-old child with hemophilia B, was rushed in the ER after he has slipped on the stairs and bumped his knee. Nurse Antonietta should prepare to administer letter boy IV infusion of factor 9. Okay, we are talking about your hemophilia B. Kapag hemophilia B po, okay, factor 9 ng issue natin. Kapag hemophilia A, that would be factor 8. Kapag may narinig po kayong classic hemophilia, it talks about your hemophilia A. Okay. Kapag may narinig po kayong Christmas disease, it talks about your hemophilia B. Pag sinabi mong Christmas disease, bakit? Saan po nanggaling yung Christmas disease? Okay. Around 1950s po kasi at one point in our history. Okay. Doon nila unang na-discover yung case na hemophilia B. Ang pinakaunang patient daw nila si Stephen Christmas, apparently. Yan po yung apelido niya. So, pinangalan po sa kanya. Okay, so number 1, factor 10, factor 9, rather, letter boy. Yan, number 1, letter boy. Number 1 is letter boy. Number 9, 1 letter boy. Number 2, Nurse Antonietta knows that Facundo's medical condition is also known as letter apple, Christmas disease. Nabanggit na natin, guys. Yun din yung isang perks na bago kayo magsagot, kalkalin niyo muna lahat ng nalalaman ninyo bago kayo sumagot sa choices. Para if ever natanungin siya sa next question, alam na natin yung sagot. Number 3, Nurse Antonietta conducted comprehensive interview to Facundo's parents to satisfy her curiosity about how Facundo acquired hemophilia B. Nurse Antonietta should note on her patient's family history of letter C, unaffected father and carrier mother. Okay. Number 3, letter C. Number 4, based from Antonietta's assessment data above, she correctly interprets hemophilia B as letter dog, X-linked genetic disorder. Okay, X-linked genetic disorder. Examples, aside from hemophilia, okay, Duchenne muscular dystrophy. What else? Color blindness. Okay, sulat na natin, hemophilia. Okay? Ayan. Autosomal dominant disorder, examples, Huntington's disease. Ano pa? Marfan syndrome. Okay. Pag autosomal recessive naman po yung pinag-uusapan, ano yung mga examples natin dyan? Sikat na cystic fibrosis. What else? Sickle cell anemia. Ano pa po? Tay-Sachs. Mga ganyan. Okay, recessive yan. Okay, Y-linked. So, kapag Y-linked disorder, this is less familiar for us, pero altered gene siya. Ang disorder niya ay dahil sa Y chromosome na alteration. Okay? So, ibig sabihin, dahil Y chromosome males, so males lang yung nagkakaroon nito. For example, yung web toe, yung pag nagdikit-dikit yung toe, Y-linked yan. Okay, so 4, it's dog. Number 5, the doctor ordered serum diagnostic studies to determine the severity and management of Facundo's condition. Antonietta has a good understanding of the disease process, if she anticipates which lab result to be often normal in patients with hemophilia. Actually, hindi naman natin issue yung amount ng platelet or yung platelet function kapag bleeding disorder. Okay, so number 5, letter C. Normal ang platelet count, yung hemoglobin normal, yung hematocrit levels normal yan. Okay, so number 5, letter C. 5, letter C. Ang normal na platelet count natin would be from 150,000 to 450,000. Number 6. Situation. Nurse working in the hemo ward of Dinuguan Hospital for 3 years is assigned to care for pediatric patients with hereditary condition. One of her patients is named Mia, diagnosed with beta-thalassemia. Iba namang pong condition ang beta-thalassemia. I-highlight natin. Pero hema disorder pa rin. Number 6, the nurse is presenting a clinical conference and discusses the cause of beta-thalassemia. The nurse informs her audience that the child is at greatest risk for developing disorder. Letter boy, child of Mediterranean descent. Ito yung tipong kapag binasa mo yung tanong, ang next mo sasabihin ay malay ko ba dito? Okay, it's either you know it or you don't. But suffice it to say, beta-thalassemia common ito sa Mediterranean descent such as Italians. Yan, ano pa? Mga Greeks, mga Syrians ng descent na yan. Okay, so number 6, letter boy. Number 6, that's letter boy. Isa pa po, number 6 is letter boy. One more, 6, letter boy. 7. The nurse added that in beta-thalassemia, which family history may be present in the development of the condition? That's letter boy, autosomal recessive disorder. Okay, so pag sinabi mo autosomal recessive, dapat lahat or dapat both na parents mo must be carriers para yung isa sa anak nila mag-produce ng symptoms, magiging symptomatic. Okay? Ayan. So number 7, that's letter boy. 7 boy. Number 8, the nurse presented assessment data she gathered from her patient. She emphasized that her patient has greenish yellow skin tone and severe anemia requiring transfusion support to sustain life. Ito lang po yung keyword na kailangan mong malaman para masagutan mo to ng tama. Okay? Ayan. Transfusion for life. She identifies this type of beta-thalassemia as letter apple, thalassemia major. Okay, kapag thalassemia major, guys, ito na po yung severe form na yan. Ayan. Number 8, letter apple. Kapag thalassemia minor naman, asymptomatic yung patient, pero carrier siya. So number 8, letter apple. Number 8, that's apple. 8, apple. Number 9, based on the patient's manifestation, severe anemia in beta-thalassemia is also known as, that's letter dog, Cooley's anemia. Cooley's anemia. Number 9 is letter dog. Number 10, the patient is receiving long-term blood transfusion therapy for the treatment of his disorder. Chelation therapy is prescribed to prevent organ damage from the presence of too much iron in the body as a result of the transfusion. So ito daw po ay letter C, deferoxamine. Number 10, letter C. Okay? Masyado ng maraming iron sa katawan. Iron overload na yan. So give your deferoxamine. Ang protamine, guys, kanino antidote ito? Ang protamine, kanino antidote ito? Okay, heparin. Okay, correct. Heparin. Warfarin, that's vitamin K. Very good. Ang naloxone, guys, kanino antidote yan? Ang naloxone, yes. Okay, opioids naman. Very, very, very good. So number 10, that's letter cat. 10 is cat. Number 11, the nurse is caring for another patient with a hereditary bleeding disorder. The nurse noted that the patient has increased tendency to bleed from mucous membranes. Most probably, the physician's medical diagnosis for this patient would be, okay, i-highlight mo ito, hereditary bleeding disorder. Meron tayong tinatawag na von Willebrand factor. Sulat ko rin. Okay, von Willebrand factor. Asan na siya? Ito pong von Willebrand factor na ito. Okay, ang purpose niya po sa buhay, okay, kung meron kang platelets, tapos nasira yung endothelium mo, right? Ito yung endothelium, tapos ito yung platelet. Okay, dapat mag-adhere si platelet dito, guys, sa nasirang endothelium. And for that certain platelet to adhere dito sa damaged endothelium natin, kailangan ng presence ni von Willebrand factor. Ganon. Okay? So even though normal naman yung platelet count natin, hindi platelet yung issue, pero nagbi-bleed pa rin siya. Baka naman kasi may issue siya dito sa von Willebrand factor, hindi mo ma-attach, hindi mag-adhere yung platelet sa damaged endothelium. Therefore, continuous pa rin yung bleeding niya. That's letter C. Yun yung feature ng von Willebrand disease. Okay? Ang tendency naman nito, ang presenting symptom nito, magbi-bleed ka, yes, pero saan karamihan or karaniwan na nakikita yung pagbi-bleed niyan? Sa mucous membranes. For example, you have your nosebleeds, epistaxis, what else? Gum bleeding, ano pa? Kapag female patient, excessive yung menstrual bleeding na. Ganon. Okay, so 11, letter C. 11, that's letter C. Ayan. 11, that's letter C. Number 12, Nurse Nicole is preparing to set or to test visual acuity of an older client using a Snellen chart. Which of the following identifies the accurate procedure for this visual acuity test? That's letter boy, right eye is tested, followed by the left eye, then both eyes are tested. So, gusto niya lang sabihin na ang visual acuity test daw, one at a time. One eyes at a time, then both eyes at the same time. So, 12, letter boy. 12, that's letter boy. One more. Number 12, that's letter boy. Number 13, the result of the Snellen's test for the older client is documented as 20/60. Uy, pwede na to. For an older client, di ba? 20/60. Okay? This can be interpreted as letter dog. The client can read only at a distance of 20 feet what a client with normal vision can read at 60 feet. Ang technique natin dito, guys, me before you. Vision ko muna. So, vision to ng pasyente. Okay, or patient. Tapos, yung 60, vision ng normal vision. Normal patient. Ganon. Normal, sige na nga, vision. Ganyan. Okay? So, me before you muna. 13, letter dog. 13, letter dog. 13, letter dog. Number 14, Nurse Nicole notes that the physician has documented a diagnosis of presbyopia to the older client's chart. She expects to assess for the presence of letter boy. Guys, i-define mo lang, i-describe mo lang. What is presbyopia? That's age-related farsightedness. Okay? Presbyopia is different from your presbycusis. Ano naman ito, guys? Age-related ano naman to? Hearing loss. Correct. Okay, age-related hearing loss. Nabibingi sa sobrang katandaan. Okay, number 14, presbyopia, letter boy po. Very good. 14, letter boy. 14, that's letter boy. One more time. 14, boy. 15, Nurse Nico is caring for another older client who has impaired hearing. Which of the following approaches will facilitate communication? That's letter dog. Speak in a normal tone. Guys, wag niyo pong sisigawan yung pasyente natin na medyo decreased na yung sense of hearing. Okay? Wag niyo rin po siyang sigawan or wag niyo siyang tabihan. Tapos dito kayo magsasalita kung saan hindi kanya makikita. You have to stand in front of the patient because it gives that certain patient a chance, correct, to read your mouth. Okay, mag-repleading na lang siya. Okay, so 15, letter dog. 15, that's letter dog. 15, letter dog. 16, should Antonio confirm that the child is not breathing, but the pulse rate is approximately 80 beats per minute? Which of the following should he do next, guys? Anong klaseng tanungan ito? ACLS. Okay, ano yung reference natin kapag ACLS? American Heart Association. Okay, nagre-revise sila from time to time. I think ang latest is 2020 ata. Okay, check natin yung resources. Pero to answer this question, to answer this question, that's letter C. Provide your rescue breathing, one breath every 3 to 5 seconds. Okay, paano po malalaman na child na siya? Okay, kapag pedia patient or infant that's 0 to 12 months of age, if the patient reaches 1 year up to 12 years old, that's the child age range. 12 years old above, adult ACLS na po yung susundin natin. Okay, when you say ACLS, yun yung algorithm na sinusunod natin. Okay? 16, that's letter C. Provide rescue breathing, 1 breath every 3 to 5 seconds. And then we would want to check the pulse every 2 minutes. So kapag ang heart rate ng pasyente less than 60 per minute, mag-start ka na ng chest compression. Let me show you the example of your algorithm. Ito yun. I think nakita niyo na po ito no college era ninyo. College era, no college time ninyo. Ayan, yung algorithm na sinasabi natin. Ay, adult pala tong na-copy ko. Sige, copy ulit natin mamaya yung children pag nag-break tayo. Pero gusto ko lang makita ninyo na ito po yung itsura ng ACLS algorithm na sinusunod natin. Okay? Sige. Kanina ang tinatanong is, the child is not breathing pero may pulse. Ito yung gagawin natin. Sa next question, ang itatanong naman sa atin ay, what if hindi na rin po palpable yung pulse ni patient? Let's letter dog. Perform CPR using cycles of 30 compression and to 2 breaths. Okay? So 17, that's letter dog. 17 is letter dog. Number 18, should Nurse Antonio's initial assessment reveal that the child is not breathing and there is no definite pulse, what should he do next after giving 2 minutes of CPR? Or utilize the emergency response system. Continue what you're doing. Okay. 19. The nurse was able to retrieve the AED and it revealed that the rhythm was shockable. Dalawa lang po yung shockable rhythms natin. Anong mga rhythms yun? Dalawa lang yung rhythm na shockable. VTAC. What kind of VTAC? VTAC na pulseless or with pulse? Dalawa yun eh. Yes, pulseless VTAC. Okay, sulat natin. Ano pa? At kapag nag-VFib, napakahirap ng sitwasyon kapag wala kang cardiac monitor. Kasi ang pasyente mo guys, cardiac ang complication. Sa isang ward, sa isang floor, okay, sa isang cardiac monitor na available sa hospital namin, 4 na ward, guys. 4 na ward ang nag-share nun. Okay? Usually, yung cardiac monitor, ibinibigay sa pasyenteng nagkukod. So napakakawawa ng mga cardiac patients natin na kailangan ng monitoring when it comes to their cardiac situations. It happened to us before. Hindi namin malaman ano na bang nangyayari sa kanya. Kasi pinull out na may nagkukod daw sa ibang ward. Diba? Napakahirap talaga. Share ko lang. So 19, that's letter apple. Resume CPR for about 2 minutes. Gusto ko lang i-re-emphasize na itong algorithm natin, wala ka po kasi sa hospital scene nito, right? Wala ka, outside hospital ka nito. So resume your CPR until the health is andyan na, until dumating yung ambulance or until maging responsive na yung child. Okay, so 19 letter apple. 17, that's dog. 17 dog, 19 apple. Okay, number 19 apple, number 20. A nurse is caring for a client with acute pancreatitis who has history of alcoholism. The client monitors the client for paralytic ill use. Ano daw? The client monitors the client. Ano to? Self-service, guys. The nurse, yan. The nurse monitors the client for paralytic ill use, which data indicates complication of pancreatitis, that's letter apple, inability to pass flatus. Again, i-describe mo lang. What is paralytic ill use? Okay, 20 letter apple. 20 letter apple. Yes, correct. 20 apple. 21. Patient Robert is diagnosed with cholecystitis. Highlight. The nurse reviews the client's medical record expecting to note documentation of which manifestations of this disorder. Select all that apply. Guys, marami-rami na rin po mga questions, nasata questions ang lumalabas sa board exam. So, the way we should do this, wag po tayong tatamarin, basahin natin ang choices isa-isa. Bakit? Kasi, paano mo malalaman na all of the above? Di ba? Kung hindi mo naman ito na isa-isa, so nahula ka lang dyan. Okay? And one more thing, guys, kapag may nakita kayong all of the above sa choices, ano pa? Kapag may nakita kayong none of the above, guys, wag po tayong uto-uto. Okay? Wag agad-agad yun yung sagot. I-confirm muna natin. Okay? But before we go to the choices, let's talk a little bit about your cholecystitis para mas malaman natin yung sintomas ng sakit. So when you say cholecystitis, chole, guys, we would want to break down the words. Chole means the bile. Okay, cyst means ano yon, yung sac, membranous sac, and itis, inflammation. Okay, so ibig sabihin, inflamed yung gallbladder ni pasyente. Gallbladder problem ito. Okay, and anong meron sa gallbladder? Okay, yung bile, guys, na andoon po natin makikita. Yung bile, that is your greenish, brownish substance na ginagawa ni liver, tapos magta-travel siya sa gallbladder, doon po siya na-store. Okay, kaya yung gallbladder in itself, kung makita niyo sa mga picture, kulay green yan. Okay, ano po ang silbi? Ano po ang responsibility ng bile sa katawan natin? It helps us to digest the fats and not even digest, absorb the fats. Okay, for example, yung mga fat-soluble vitamins natin, please give me one. Ano yung mga example ng fat-soluble vitamins? DEC, guys, DEC. So, kung medyo dysfunctional yung gallbladder natin, kung medyo naka-block yan or inflamed yan, hindi tayo magkakaroon ng access sa fats, hindi rin natin madadigest yung mga ganyang vitamins. Or kung madigest man, it's very, very hard for the body to do that. Okay? Isa pa po, ang bile, yung greenish-brownish substance sa pinag-uusapan natin. Okay? Very, very important din yan para ma-excrete natin, para malabas natin yung bilirubin. And when you say bilirubin, familiar. Okay? Nakikita po natin ito, okay, kapag nag-breakdown na yung sira-sirang red blood cells. Right? Di ba kapag nasira yung red blood cells natin, magpuproduce siya ng bilirubin? Okay? So kapag hindi naman masyadong nare-release ng maayos yung bile natin, affected din yung bilirubin natin. So yung kulay ng stools, yung kulay ng urine, ng mata natin, affected. Okay? Sige, so let's take a look at the signs and symptoms of cholecystitis. Of course, dyspepsia. When you say dyspepsia, ano to? Pinasocial term for what? Pinasocial term, indigestion. It just talks about your indigestion. Guys, kapag may kapag nakaka-encounter kayo ng medyo overwhelming words na parang, hindi ko alam to, or hindi ko to nabasa, you have to relax. Okay? And understand the context. Alam kong alam nyo yan. Alam kong nabasa nyo yan. Minsan hindi lang nasasagutan na maayos kasi nagpapanik or napanguunahan ng kaba or ng anxiety. Okay, again, a mantra natin for today, when you relax, it's there. Kita natin yung sagot. Okay? Number 2, dark stools. But dark stools? Parang may mali. Dapat clay-colored stools ito. Okay, clay-colored stools yan. So, burahin natin yung dark stools. Tapos yung dyspepsia, highlight na natin. Yan, para kitang-kita. Light-colored urine and clear urine. But parang baligtad sa number 2, hindi rin yan kasali. Okay, baligtad siya. So, dapat dark-colored yan. Dark-colored urine, ganon. Number 4, feelings of abdominal fullness, of course, kasama natin yan. Rebound tenderness in the abdomen, kasama rin natin yan. Okay, number 6, upper abdominal pain that radiates to the right shoulder. Of course, gallbladder issue, kasama rin natin yan. Meron tayong tinatawag na Murphy's sign. Okay. The Murphy's sign is done when you have to lay the patient in a flat position or supine position. Tapos ipapalpate natin yung ribs sa right side. Okay? Sa right side, sa may mid-clavicular line, so medyo sa taas. Okay? Kung nasan yung gallbladder area. Okay? Gusto natin na huminga yung pasyente, breathe out, then breathe in. Okay? If the patient breathes in, ipapalpate mo yung area under the ribs. And if the patient would stop breathing in during the palpation, ibig sabihin, nasaktan siya, guys. Positive yun for Murphy's sign. That's what you call your Murphy's sign. Okay? Ayan. So, kung ano lang po yung highlight, yun lang yung makikita natin sa choices. So, that's 1, Murphy's sign, S-I-G-N. 1, 4, 5, and 6. That's 1, 4, 5, and 6. Letter C. 21, letter C. 21, that's letter C. Okay. 21, letter C. Number 22. Which of the following diet is required few days after cholecystectomy? So we would want your GI to rest. Okay, gusto natin NPO muna. Pero after NPO, clear liquids after. Tapos si advance na lang natin. 22, letter C, clear liquids. 22, letter C, clear liquids. Again, 22, letter C, clear liquids. 23, patient Jake undergone cholecystectomy. Was found to have a T-tube inserted after surgery. What is the purpose of this tube? Guys, define muna natin ang tong surgical term na to. When you say cholecystectomy, tinanggal mo po yung gallbladder, removal of the gallbladder. Tapos, meron siyang inintroduce na equipment. T-tube ang tawag dyan. Okay? To maintain the patency of the common bile duct. Okay, 23, letter apple. 23 is letter apple. That's letter apple. 24. As the nurse performs teaching to a group of nursing students, which of the following types of liver cirrhosis has the highest incidence? That's Laennec cirrhosis. In other words, this is your alcoholism cause. Alcoholic liver cirrhosis. Okay, 24, letter apple. 24, letter apple. What is the most life-threatening complication of any liver disease? Sabihin natin liver cirrhosis. Anong pinakaayaw nating mangyari sa pasyente na to? Hepatic enceph. Okay. What else? Balikan natin yung physiology or yung purpose ng liver sa katawan. It has something to do with the clotting functions, right? So kung impaired ang liver, hemorrhage, mami, bleeding ang issue natin. Meron na akong pasyente, grabe, night shift. Okay, night shift. First rounds ko, that's 12 onwards, okay? Siya yung una kong pinuntahan. GCS 15 naman siya. Okay, liver failure, alcoholic liver cirrhosis, very ascites, very yellow jaundice na siya, okay? Okay naman siya apparently. Tapos around 1:15, 1:20 a.m., sabi sa akin ng colleague ko, uy, pwede mo bang puntahan si bed ganito? Kasi sumusuka siya ng dugo. Or nagsusuka siya ng plema na may dugo. So pinuntahan ko. Tapos nagsusuka nga siya ng plema. Actually, the way that I referred that to the doctor, sabi ko meron po siyang hemoptysis. Akala ko hemoptysis yung nangyari. Okay. Sabi niya, okay, sige, pupuntahan daw ng doktor. Yan. Tapos after 15 minutes, as in ang bilis ng deterioration ni patient, okay, nagdi-DOB na siya, hirap na siyang huminga, deranged na yung vital signs niya, so nag-oxygen support tayo, pero 15 LPM hindi pa rin sapat, okay? DOB pa rin siya, ni-refer na natin siya sa doktor. Okay, apparently, ang doktor guys, yung NGT niya, pina-flow niya, open to drain, okay? May dugo everywhere. Okay, so nagdudugo na nga siya sa bibig, nagdudugo pa siya sa NGT niya, dugo na yung ilong niya, tapos DOB na siya. Anong tawag natin? What is the medical term that is used when a patient is vomiting blood? When the patient is vomiting blood, hematemesis. Hematemesis ang nangyayari sa kanya. When I referred him to the doctor, sabi ko hemoptysis. Okay? Turns out, hindi pala galing sa respi yung dugo. Okay? Sa GI niya, nagkakaroon na siya ng bleeding. Okay? Secondary to esophageal varices. Right? And kapag nagbi-bleed ang pasyente, in-intubate namin siya, pero suction kami ng suction. At the end of the shift, we were able to suction around 1 to 2 liters of blood. Sa lungs pa lang yon, iba pa yun sa NGT, parang 1 liter din ata sa NGT. Okay? Upon endorsement, nag-code si pasyente. So 12 guys, di ba? Parang 1:15 siya nag-start mag-deteriorate, mag-toxic. Mga 6:30 nag-code siya. Kasi eventually, continuously hypotensive, tas nag-code. Na ano naman, na-revive naman namin. Pero parang hindi rin siya nag-survive around PM shift. Around tanghali, hindi na rin. Okay? So yun yung isa sa mga fatal complications ng liver failure natin or liver cirrhosis. Bleeding, guys. Kung continuously kang nagbe-bleed, hindi man siya outright bleeding, baka internal bleeding yun nangyayari. Tapos kung hindi rin naman sapat, yung dami ng blood transfusion, hindi siya makakeep up sa amount na ilalabas ng katawan, mag-fail talaga yung mga body organs niya. Okay? So, anong learnings natin doon? Huwag tayo mag-underestimate ng mga complications. So, kailangan natin siyang, huwag uminom, of course, number one. And as a nurse, as a medical professional, hindi, okay yan. So, patients, huwag uminom. Number one yan. As a medical professional, syempre, kapag sinabing watch out for this one, refer if with this one, okay, gawin natin kasi mahirap agapan kapag mga ganon. Tapos you would want to analyze carefully yung case ng pasyente because yung prognosis dapat i-anticipate na rin natin yung mga worst na pwedeng mangyari para prepare tayo sa proper and accurate management. Okay? So yan, 24 letter apple. Yan. 25, which manifestation is related to liver cirrhosis? That's letter apple, fetor hepaticus. When you say fetor hepaticus, napakabaho daw po no hininga ng mga pasyente natin with liver cirrhosis. As the textbook says, okay, the breath has a strong musty fecal odor. Ganon daw. Amoy dumi daw yung hininga niya. So, ganon siya kabaho. So, 25, letter apple. Okay. Ito uremic frost, guys, hindi naman to related sa liver cirrhosis. This is more on your CKD wherein, okay, napakataas po ng urea concentration niyan. Nagki-crystallize na siya, nagde-deposit na siya sa skin. Okay, ito pong nevus flammeus. Mas familiar po itong term na to sa pedia concept, if you would remember. Para siyang balat, yung birthmark niya, pero ano itsura? Color pink. Okay, yun yung nevus flammeus natin. So 25, that's letter apple. Okay, 25, that's letter apple. One more, 25 is apple. 26, patient Romano suffers hepatitis C, which develop into liver failure and GIT hemorrhage. Which of the following blood products would bring hemostasis to the client? That's letter dog, cryoprecipitate and FFP. So kapag coagulation issue, ito yung gusto nating ibigay sa patient. Kailan lang tayo nagbibigay ng whole blood transfusion? Actually, hindi naman ganun kadalas. Okay? And kapag nakita nyo yung bag ng whole blood, napaka-chunky niya. Ganun siya ka-thick, ganun siya kadami. Okay, usually, ibinibigay po natin ito sa mga patients na meron traumatic hemorrhage. Okay, kapag napakadami na ng blood loss niya. Okay, when you say blood transfusion na RBCs naman, pag RBCs lang yung gusto mong i-transfuse, anong issue niya? Okay, yung RBC level lang talaga. Baka may anemia siya. Okay, baka may anemia siya. Kapag albumin naman, when you say albumin, mahal to, guys. Okay, mahal ito. Gusto ko lang siyang i-inform. Okay, plasma expanders naman tawag natin dyan. Okay, this one is your plasma expander. Usually kapag may edema yung patient, bibigay tayo na albumin. Okay, so 26, that's letter dog. 26 po, that's dog. 27, patient Sherwin has a recent history of rectal bleeding, being prepared for colonoscopy. I-highlight natin, colonoscopy procedure po yan. How should the nurse position the patient initially? So when we are talking about your positioning, anong concepts ito under fundamentals? Okay? Sino lecture niyo for funda? Na-curious lang ako. Sino lecture niyo sa funda? Si Doc. Yung isa, si Sir Lian, si Doc Oleni, Doc Irie. Okay, iba-iba. Alright, so that's letter C, lying on the left side with the legs bent. Bakit? Bakit side lying tapos left side? Kasi kapag ganun yung position ng pasyente, mas mako-follow natin yung contour ng small intestines natin. Mas okay na yung pag-navigate, okay, sa intestine sa loob. So 27, letter C. Diba? Akala natin parang kung ano-anong positioning lang yung kailangan, pero may rational, even the positioning of the patient. 27, that's letter C. 27 is C. 28, patient Dante is recovering from an ileostomy that was performed to treat inflammatory bowel disease. Meron tayong two most common types of your IBD. Can you give me one? Yes. Ulcerative colitis and your Crohn's disease. Okay, mas mapag-uusapan nyo yan as you go along through your intensive phase of your review. Okay, during discharge teaching, which of the following should be taught to the client? That's letter apple. Increase your oral fluid intake to prevent dehydration. Okay? Either which, guys, kahit anong meron yung pasyente, whether Crohn's or ulcerative colitis, isa po sa mga presenting symptoms niyan is yung diarrhea. Okay, not only diarrhea, bloody diarrhea. Okay, bloody diarrhea. So, ayaw natin na mag-dehydrate yung pasyente. So, advise natin to increase the OFI. 28 is apple. Okay, 28, that's letter apple. 29, Nurse Denoris is taking care of a patient with liver cirrhosis. Which of the following assessment findings is consistent with the complication of deficient clotting factors? Okay, sige. Highlight ko lang po yung focus ng tanong. Liver cirrhosis daw po. Ano pa? Complication of deficient clotting factors. That's letter C, purpura. Okay, that's letter C, purpura. Para siyang pantal-pantal na maliliit, parang ganun. So kapag mas malaki siya sa, let's say, 1 centimeter, okay, yung purpura kasi maliliit yung itsura niyan. Pag medyo lumaki-laki yung parang pantal na itsura niyan, ecchymosis na yung tawag. Yan. 29, that's letter C. 30, when evaluating a male client for potential complications of pancreatitis, which of the following should be monitored? Okay. If you are thinking about the potential complication, you may also would want to consider, okay, or to think about yung mga extra pancreatic symptoms natin. So, minsan, affected pati yung kidney function. So, 30, letter boy. 30, that's letter boy. Decreased urine output. 30, letter boy. 31, what lab finding is primary diagnostic indicator for pancreatitis? That's letter C, elevated serum lipase. 31, that's letter C. 31C, 32, which the following tests would confirm upper GIT bleeding? That's letter apple, endoscopy. Endoscopy. Anong itsura ng stools ng pasyente? Anong kulay kapag meron siyang upper GIT bleeding? Dark what? Dark what color? Yes, it's called melena. Pero yan, black tarry stools, okay? Black tarry stools. And you have to make sure, bago mo sabihin sa doktor na, Dok, nagme-melena yung pasyente, you have to make sure na black tarry talaga siya. Minsan, guys, okay, for me to properly assess the stool of the patient, okay, as in, kailangan mo talaga siyang dukutin sa diaper ng pasyente. Kailangan mo siyang tingnan closely. Kasi minsan, yung stool niya, dark green lang pala. Okay, iba kasi yung dark green sa black talaga. Okay, so ayan. So 32, that's letter apple, endoscopy. Kapag lower GIT bleeding, what color of the stools? Bright red naman. Okay, bright red naman. Correct. Okay, sige. 33. Patient Sansa is suffering from dysphagia and is being prepared for discharge. Which should be advised to the client? Dysphagia is painful swallowing. Okay, mahirap sa kanyang lumunok. That's letter apple. Patient should eat upright. To avoid any complication of possible regurgitation or aspiration. At the same time, kapag may dysphagia ang patient, recommended ba na thin, okay, yung soup na ibibigay natin sa kanya? Kailangan bang manipis? Parang dapat thick. Ano? Dapat thick. So, mali talaga to. Ay, bakit ko in-highlight? This should be thick. Yan. So, 33, letter apple. 33, letter apple. 34, while palpating patient Marguerite's right upper quadrant, the nurse would expect to find which following structures. Actually, guys, the BUN could ask a simple question as this one. So please review your anatomy because they would ask questions like this. The best answer is letter apple, liver. Right upper quadrant, liver. What about appendix? Ano quadrant niyan? Nalipat na ba yung appendix sa left? Wait lang, nalito ako. Bakit may sumagot ng left? Ito ba yung left? Okay. Sabi ko lang, pinagdudahan ko for a split second yung knowledge ko. Okay, right lower quadrant. Okay, kapag spleen, saan natin makikita yung spleen? Yun, kabaligtaran. Okay, left na to. Left, I'm sorry, upper lower, upper to eh. Left upper quadrant. Yan. Tapos ang sigmoid colon, ito na yung left lower quadrant. Okay, left lower quadrant. Wait lang, meron ako nakita dito. Ay, sa POV pa lang ng nurse. Ha? Hindi, kahit kaninong POV, guys. Ayun, sa patient. Patient. So, liver, right upper. Okay? Appendix, right lower. Walang POV ng nurse na kino-consider. Laging sa patient tayo magbe-base. Okay? So, ang spleen, left upper yan. Ang sigmoid colon, left lower quadrant. Ayan. GG sa Ana. Okay lang yan, guys. Okay, marami pa tayong time to review your anatomy concepts. Okay lang yan. There's always room for improvement. Okay, so 34, that's letter apple. 34 is apple. 35, the nurse is caring for patient Brian with active upper GI bleeding. Ito rin yung isang kagandahan kung bakit tayo nagra-ratio kasi mas na-analyze natin kung ano ba yung kailangan ng concepts na i-refresh pa natin better than the other concepts. Okay, so what is the appropriate diet for this client during the first 24 hours after admission? Syempre guys, gusto natin na pagpahingahin muna yung GI niya. So NPO muna. And aside from your GI rest, we would also want to explore further the cause of that upper GI bleeding. So wag mo muna siyang lagyan ng pagkain. 35 letter C. NPO. 35 letter C. Isa pa po. 35 cat, number 36. Situation, 55-year-old female patient is admitted due to profuse vaginal bleeding. She underwent ultrasound and laparoscopic examination. She was diagnosed with leiomyoma. Highlight natin yung 55-year-old patient. Highlight mo yung Q na ibibigay sa atin. Okay, ano pa? I-highlight mo yung actual medical condition niya. Okay, which of the following is not true regarding leiomyoma? I-highlight mo ng malala, okay? Yung word na not true. So, ibig sabihin, yung mali, yung hahanapin natin. Okay? If you would read about your leiomyoma, okay, benign tumor lang yan. So, when you say benign, slow-growing tumor. Okay? Usually, ang slow-growing tumor natin, like myomyoma, kahit hindi mo na i-surgery, okay, medyo conservative treatment, pwede na rin naman yan. Sa natin to usually makikita sa uterine myometrium. Okay, myometrium po yan. Therefore, letter apple is not right. So, not true. So, ito yung sagot natin. So, this should be myometrium. Okay, so 36 letter apple. Okay, so since myometrium po yung organ of affectation, syempre, smooth muscle cells tayo dyan. 37 letter C. 37 letter C. 37C, number 38, glycerylin, a gonadotropin-releasing hormone agonist, is prescribed to the patient. What or which among the following is a common side effect of the drug during the first days of administration? So let's talk a little bit about your gonadotropin-releasing hormone agonist. Guys, I would like to remind you or to tell you as early as now na meron po talagang lumalabas na pharmacology type of questions sa board exam. Okay? Ang masasuggest ko or ma-advise ko sa inyo is that alam kasi natin yung nature ng pharma na concept. Aminin na natin yan, nakakatamad siyang aralin. Diba? Nakaka-overwhelm, nakakatamad aralin. Pero kailangan kasi. Wala tayong choice. Pero so paano natin siya aralin? For me, okay, kunwari ang organ system na gusto kong aralin is respiratory system. Isasabay ko na yung mga pharma drugs na related sa respi. Next naman, kapag neurosystem naman yung inaaral ko, isasabay ko na yung mga neurodrugs para hindi yung isang bagsakang puro pharma drugs siya. Okay, so depende ako sa body systems nag-aaral. Okay, going back to this question, ang nature ng glycerylin, okay, magkakaroon ka muna ng flare-ups dyan. When you say flaring, mag-worsen muna yung symptoms, okay, bago mo ma-achieve yung designated therapeutic effect ng gamot. So 38 letter apple, flaring yan. So 38 letter apple, flaring. Yung akala mo parang hindi gumagana yung gamot, yung Coserilin, pero kailangan lang ng tamang nursing education sa patient. Na ito yung kailangan mo i-expect. Mag-worsen mo na yung symptoms, then kung mapapansin mo, mag-fade din naman yan. 38 is apple. 38, that's letter apple. Number 39. After the GnRH agonist therapy, the patient is about to undergo uterine artery embolization. What is the mechanism of this therapy? Nagigets niyo pa ba yung feature ng kwento? May kwento to, guys. Okay? May tumor si pasyente. Okay? Tapos, napag-decidean na ang management daw ay uterine artery embolization. Ano daw yung ginagawa with that kind of procedure? That's letter dog. Pellets are inserted into the uterine artery to cause the blockage. Okay? So, imaginein natin, may tumor ka dito. And that tumor feeds off the patient's sa blood vessel, sa blood. Okay? Gusto niya ng blood supply ng pasyente. Okay? Therefore, kung aagawin natin yung blood supply, okay, kung hindi natin siya bibigyan ng enough blood supply, anong tendency ng tumor? Mag-shrink siya. Okay? So, yun yung reason kung bakit mag-i-insert tayo ng pellet. Okay? Iba-block natin yung blood supply na yun that would feed off the tumor. Okay? Para mag-shrink yung tumor. So, 39, that's dog. 39, that's letter dog. Nagigets nyo pa ba ako, guys? Are you still with me? Okay lang? Okay. Okay, sige. 39, that's letter dog. 39, that's dog. 40, to be able to distinguish it from a cancerous lesion. What is the standard diagnostic test that should be performed? Whichever type of cancer you have, guys. Kahit anong type ng cancer na meron ka, biopsy is still the answer. Diagnostic test, biopsy ang isasagot natin. Wala na pong iba. Okay, 40 letter boy, biopsy. 40 letter boy, biopsy. 40 boy, 41. Situation in the United States, around 40,000 cases of endometrial cancer are documented annually. Gina is a 56-year-old female patient diagnosed with stage 2 endometrial carcinoma grade 1. Sige, balik lang po tayo saglit. May nagtanong po, para saan po ang pap smear? Diba? Yung pap smear, guys, basically, ipiperform yan sa female patients natin to detect kung meron ba tayong cervical lesions. Okay? That's more on your cervical cancer. Okay? Gusto lang niyang, yes, screening lang siya for your cervical problems. Hindi siya diagnostic. Iba po yung screening sa diagnosis. Okay? Ang pap smear that is best done, okay, around 22 to 25 years of age. Pang baseline mo na rin yan. Okay? Sige. Especially, for example, naging sexually active ka by your age 18, 19, or 20, expected mo dapat within a year magpapap smear ka as your baseline lang. Kasi, as we know, ang cervical cancer, isa sa pinaka-risk factor niyan, having your multiple sexual partners. Ayan. So, dun papasok yung pap smear na concept. Okay? Ayan. So, 41, balik lang po tayo, endometrial carcinoma naman, commonly preceded by which of the following conditions? Okay? Again, guys, kailangan nyo pong i-brush up din yung vocabulary ninyo. When I say vocabulary, the words that being used sa board exam, baka hindi nyo alam. Okay? For example, preceded. Ano yung preceded? Minsan alam natin yung nursing concept, pero nadadali tayo sa words na ginagamit ng BUN. Medyo malalalim. Okay? So, ang tinatanong sa number 41, ano daw muna yung mangyayari bago ka magkaroon nitong endometrial carcinoma? Which would happen first before you have your endometrial carcinoma? That's letter C, endometrial hyperplasia. And when you say endometrial hyperplasia, okay, kakapal po yung lining ng uterine lining natin. Uterine lining, endometrial lining, kakapal siya. And with that, kapag kumapal yung uterine lining natin, it's very, very prone to have your cancer na. Okay, so 41, letter C. Itong HPV infection, hindi siya sa endometrial cancer, more on cervical cancer to. STDs. Okay, so 41, that's cat. 41, that's letter cat. 42, what is the most common type of endometrial carcinoma? That's letter boy. Adenocarcinoma. It's very so much common. In fact, according to studies, 80% of your types of adenocarcinoma, ay mali, baliktad, 80% of your endometrial carcinoma is an adenocarcinoma. The rest, guys, okay, cumulative na 20%. Ganun siya ka-common. 42 letter boy. And if you would also notice yung types of questions na tinatanong sa atin, it's very, very, very technical. For me, it's either you know it or you don't. Maraming ganito sa board exam, guys. Gusto ko lang kayong i-ready. Okay, yung tipong kapag hindi mo siya nabasa, wala. Nga, ganon. Context clues tayo. Ganon. Okay, so 42 letter boy. 43, which among the following does not contribute to the development of endometrial cancer? Okay, does not contribute po. Yun tanong. So that's letter apple. Use of oral combination contraceptives, estrogen plus progestin. Okay, ang progestin po or ang progesterone, it acts as your protective factor against your endometrial cancer kasi. So kapag gumagamit ka ng contraceptives na may progesterone, actually less risk for you, okay, to have this type of cancer. Pero kapag estrogen lang, yung component ng contraceptive, it could actually increase your risk kasi wala kang protection. Okay, so 43 letter apple. 43 po is apple. Again, number 43, that's letter apple. Number 44, the patient underwent an radical hysterectomy with bilateral lymph node dissection and removal of the upper third of the vagina. Okay, she asks you when she can have intercourse with her husband, feeling that she might have complications. Your best response would be, actually yung concern niya, it's a very, very valid concern. We know this, right? And with every couples, very necessary for them yung sexual intercourse. It's part of the relationship, guys. Yun yung concern niya. Okay? As we know, ito yung sasabihin natin, you should avoid sexual intercourse for at least 6 weeks for the wound to recover. Kasi yun yung site talaga, yung surgical site natin. Andun yung sugat. Okay? So pagpahingayin mo muna. Okay? But when we are talking about your ADLs, when can I resume my ADLs? Kapag yun naman yung tanungan, as early as 2 weeks, pwede na. Okay? As early as 2 weeks, pwede na. Pero yung sexual intercourse, since nandun yung surgical site natin, at least 6 weeks pa dapat yan. Okay, so 44 letter boy. 44 letter boy. Again, number 44 letter boy. 45. Which among the following signs and symptoms should the patient report after discharge? Okay, that's letter C. Calf pain and tenderness, which signifies the presence of what? Okay, deep vein thrombosis. In every types of your pelvic surgery, kung hindi man actual pelvic surgery, pero malapit doon, guys. Yes, very, very prone ang patient natin to have your deep vein thrombosis. One of the signs for us to know na baka nagdi-DVT na siya is to assess for your calf pain and tenderness. 45, letter C. 45, letter C. 45 is C, situation. 46, nursing knows that proper knowledge on the different causative agents, ito na tayo guys, and manifestations of the reproductive disorders will help in the proper management of patients. So reproductive disorders or yung STIs natin, as we mentioned before, part siya ng communicable diseases, right? 46, what is the most common cause of vaginitis in women? Okay. Magkaiba po ang vaginitis sa vaginosis. Just to clarify, so isulat natin, vaginitis not equal to vaginosis. Ganon. So pag sinabi mong vaginitis muna, pag sinabi mong vaginitis, itis guys, inflammation ng vaginal area natin. There's something wrong. Okay? Yun yung parang umbrella term natin with the rest of your STDs. For example, vaginosis. Another example, candidiasis or trichomoniasis. Pwede natin siyang isubsume under your vaginitis. Okay? So ano daw yung pinaka-common cause ng vaginitis? It's letter apple, vaginosis. In fact, guys, bakit ba nagkakaroon ng bacterial vaginosis? Nagkakaroon tayo ng imbalance sa pH ng vaginal environment natin. As we know, ang normal vaginal environment is that alkalinic or acidic? Alkalinic or acidic? Kailangan natin yung malaman. Uy, walang nagkakamali, guys. I'm really so proud of you. Okay, ang galing niya, guys. Like legit, walang bola. Okay? As we know, acidic in nature ang vagina. Kapag yan, nagkaroon ng overgrowth ng bacteria, nagiging alkaline na yan. So, syempre, if it deviates from the nature, di ba, nagkakaroon tayo ng problema, it becomes an issue. So, yun yung bacterial vaginosis. 46 letter apple. 46 letter apple. 47. Ay, sige, wait lang. Tanungin ko, ano ang causative agent ng candidiasis? Bacteria, fungi, parasite, virus. Ano ang common causative agent ng candidiasis? Di ba kapag yun ang tinatanong, doon lang kayo mamimili? Fungi. Okay? Fungi po yan. Ay, ang trichomoniasis. Ano ang causative agent ng trichomoniasis? Bacteria, fungi, parasite, or virus? Sure. Bacteria, final answer. Trichomoniasis. Bacteria, parasite. Ma'am Angela, parasite, question mark. More confidence. Ma'am Jasmine, ano yan? Tanggalin natin yung question mark. Parasite siya. Okay, so pag candidiasis, fungi. Kapag trichomoniasis, nagiging parasite. Parasite na siya. So single cell na protozoa, trichomoniasis yan. Okay, next one. Marami pa tayo dito. 47, 29-year-old patient with history of multiple sexual partners is admitted due to foul-smelling grade vaginal discharge. Okay, highlight mo yung age. Highlight mo yung symptom. Yung discharge niya. Upon microscopic examination, clues are seen and there are no lactobacilli present. Okay, what is the causative agent of this condition? Okay. Para malaman natin kung ano ang causative agent, kailangan mo nating i-identify yung actual sexual transmitted disease na tinutukoy ng question. This one is your bacterial vaginosis. Madali lang maintindihan or matandaan yung bacterial vaginosis. Basta kapag mas dumami yung bacteria, yung bad bacteria, kasi sa good bacteria, sa vaginal area. Okay, nagkakaroon ka ng bacterial vaginosis. In fact, ito, tingnan mo, no lactobacilli present. Di ba ang lactobacilli, good bacteria yan. So kapag nawalan or naubos yung good bacteria, okay, vaginosis yon. Letter dog, Gardnerella vaginalis. Etong Gardnerella vaginalis, anong causative agent niyan, guys? Bacteria, fungi, parasite, virus. Bacteria, fungi, parasite, virus. Guys. Bacteria, question mark, Sir Jed. Bacteria with conviction. Sure na. Okay, tama ka naman. Okay, bacteria ito. Okay, bacteria yan. Ang treponema. Kaninong yan? STD yan. Kanino natin maririnig yung treponema na yan? Yes, syphilis yan. So ano naman to? Bacteria, fungi, parasite, virus. Ayaw tantanan yung tanong. Gusto ko lang kayo masanay sa ganong klaseng question because I think it would really come out. Come out. Yon, bacteria yan. So bacteria pa rin yan. Ganun. So syempre ito hindi natin itatanong kasi virus siya. Obviously. So 47, that's letter dog. Bacteria. Gardnerella vaginalis. Okay, so 47 is dog. 48, which among the following strains of HPV is implicated in the development of condyloma acuminatum? This should be acuminatum. Okay, I think familiar sa inyo itong term na to. Ano to? Warts yan. Okay, secondary tier HPV. That's letter boy, HPV 11. Okay, aside from HPV 11, HPV 6. Nagko-contribute din yan. Okay, so 48 letter boy. 48, that's letter boy. One more. 48, that's letter boy. 49. Herpes simplex virus has the propensity to become latent in patients. They usually ascend the peripheral sensory nerves and become dormant in which of the following structures? Tapos ito na namin sabihin mo, malay ko ba? Anong sagot dito? Ganyan, okay? So peripheral sensory nerves daw, guys. Ito yung palatandaan natin. Dorsal root ganglion ang sagot. Okay, pag dorsal po, it talks about your, ay, i-caps lock natin. Pag dorsal po, it talks about your sensory. Okay? Ano yung kabaligtaran ng dorsal, guys? Ventral. So, nasagot na yung sensory, so motor tayo dito. Yun yung pinagkaiba nila. Okay? So, 49, that's letter boy. 49, that's letter boy. 49 po, that's letter boy. Number 50, 35-year-old patient complains of clean frothy discharge accompanied with vulvovaginal pruritus. Okay, and upon colposcopy, the cervix was seen to be erythematous with multiple small petechiae appearing like strawberry. So, ang tawag natin dyan, strawberry cervix. Okay, knowing what usually causes strawberry cervix, ano daw yung medications natin? This one is metronidazole. In fact, kapag narinig mo yung strawberry cervix, dito na po e-enter si trichomoniasis. Trichomoniasis yan. Okay, na parasite ang cause. So 50, that's letter apple. Do you want to have a break? Toilet break lang na 5 minutes. Okay lang. Okay lang sa akin. Sige, mag-break muna tayo na 5 minutes. Okay, thank you guys. Number 51, situation. 54-year-old man is brought to the emergency room unconscious. Heart rate 100, BP 160, temperature 37.2 or 22. Hemorrhagic stroke is the primary impression. Okay, so again, to re-emphasize lang, basahin niyo po yung situation hanggang dulo. Bakit? Because it gives you a clue on the type of questions that would be asked ahead. Okay, so sabi daw dito, hemorrhagic stroke. So expect mo the next questions about the stroke. So number 51, the most common cause of subarachnoid hemorrhage is a rupture of saccular aneurysm located in the circle of Willis. Which among the following vessels is not a part of the circle of Willis? Gusto ko lang i-appreciate nyo kung gaano kaganda for me. Okay, yung circle of Willis. Ito siya guys. Meron akong nakitang picture sa Google lang. Okay, parang na-extract nila yung circle of Willis na hindi na-detach yung pieces together na isang buong yan na-extract nila sa patient. Okay, if you would notice, puro artery siya. Okay, so puro artery siya. Ang purpose po ng circle of Willis is that kapag meron kang isang naka-obstruct na blood vessel dito, meron pa siyang collateral na blood supply. Okay, so kapag sinabi sa'yo circle of Willis, think of your collateral blood supply. So kung hindi siya makadaan dito, okay, it will find for another way to pass through para masusupplyan niya pa rin yung certain artery na yon. Okay? So balik tayo sa question. So ito po yung mga arteries na involved. You may want to screenshot this. I just borrowed this from Google, so okay lang naman. Okay? Balik tayo. Ano daw yung hindi part? So i-highlight natin yung word na not. That's letter boy, basilar artery. 51 letter boy, basilar artery. 51 letter boy, basilar artery. Yung iba na medyo photographic yung memory, mas gusto nila na may pictures na involved. Okay lang din naman yun para mas maalala nyo siya. 52, what is the most common symptom that precedes hemorrhagic strokes? Ito na naman yung word precede. Okay? Ano daw muna yung nararamdaman ng pasyente bago siya magkaroon ng actual hemorrhagic stroke? Okay, it's letter C, sudden severe headache. Sasakit muna ng malala yung ulo niya, tapos magkaka-stroke na siya. I have a question. Which is more common, ischemic or hemorrhagic? Which is a more common type of your stroke, ischemic or hemorrhagic? Okay, ischemic strokes, isulat natin, ischemic stroke, this one is most common. In fact, according to your article, sabi daw parang mga 87% ng cases ng stroke ay ischemic stroke. Okay, the rest, hemorrhagic stroke na siya. Okay, hemorrhagic stroke. So ito, less common, 13% lang siya. Ano pa? Ano yung feature ng ischemic? So kapag ischemic stroke, think of your blood clots. Okay, may obstruction ka dyan. Okay? Kunwari embolus or embolic stroke, ischemic yan. Kapag hemorrhagic, of course, andyan naman yung bleeding. Okay, so pag ito, okay, meron tayong ischemic stroke na embolism. Pwede rin naman na thrombotic stroke. Which is more sudden, embolic or thrombotic stroke? Which is more sudden, embolic or thrombotic stroke? More sudden, tama. Embolic or thrombotic? Embolic or thrombotic, guys? Sudden. Bigla na lang, na-dislodge kasi. Embolic. Right? Embolic siya. Okay? Pag hemorrhagic, it's more on the bleeding. For example, uncontrolled yung hypertension mo. Ano pa? May aneurysm ka. Aneurysm. Ano spelling? Aneurysm. Ganyan. Hemorrhagic stroke. Yan. So that's letter C. Okay, so 52 daw, hemorrhagic stroke, letter C. 53, what or which among the following drug orders for the patient will alert the nurse to ask the physician? Doc, may stroke po yung pasyente, tapos nag-order ka po ng Coumadin. Okay, baka po pwedeng paki-review po ng order kasi nagbi-bleed na po siya, baka mas lalo po siya mag-bleed. Okay, thank you po. Okay, 53, that's letter boy. Coumadin. or warfarin. Ito po yung 53. Or you mean 52? Ayan. 52, that's letter C. 53, that's coumadin, letter C pa rin. Okay na tayo, 52, letter C. 53, letter boy. Boy pala to, guys. Boy coumadin daw. 54, which acid-base balance is usually seen after subarachnoid hemorrhage? That's letter apple, hyponatremia. It has something to do with the fluid shifting. Okay, so salt and water, syempre, ang involved. 54, letter apple. 54, letter apple. Number 55, in the presence of aneurysm, you institute the following interventions, except. Okay, presence of aneurysm, i-highlight mo. Tapos yung interventions na gagawin daw, except. So may word na naman na except. Lagyan mo ng negative sign dyan. That's letter boy. Administering enema for constipation. Bakit? Ayaw nating nag-i-strain yan. Okay, bakit? Kasi mabibigla siya. Sudden release or strain. Okay, abrupt increase sa increased blood pressure, lalo na kapag meron kang uncontrolled na blood pressure, okay, magbo-burst yan. Ayaw natin mangyari yon. So 55, letter boy. Okay, 55, letter boy. 56. Situation in the US, apparently naulit na po. So endometrial carcinoma, letter C daw, endometrial hyperplasia. Okay, 57, adenocarcinoma. 57 is adenocarcinoma. 58, letter apple. Use of oral combination contraceptives. Yes, naulit na po. Okay, sorry. 59, letter boy, at least 6 weeks. Avoidance of sexual or intercourse. 59 is letter boy. Number 60, that's letter C, calf pain tenderness. Okay, baka may DVT na si patient pag may ganyan siya. 60 is letter cat. 61, situation. 58, naulit na po ito, but that's letter apple. 58, apple. Since 2012, there has been a shift in nursing core competency standards. From 11, it has been compressed into 3. These are beginning role of nurses in client care, leadership management, and research. To be successful in the local board, student nurses must master Palmer concepts. The following questions apply. Number 61, during orientation, student nurse Maxine learns that the nursing model of practice implemented in the facility is a primary nursing approach. Pag sinabi mong primary care, parang ikaw lahat dun sa patient na yon. Okay? When she attends a report on the medical unit, she will verify with the staff which of the following characteristics of primary nursing. Letter dog. From assessment, vital signs, interventions, to carrying out the doctor's order, ikaw yan. Primary nursing. Single RN is responsible for planning and providing individualized care for 4 to 6 patients. Okay? Etong letter apple, critical paths are used when providing client care. Parang hindi siya primary nursing. Parang more on case management yan. Okay? Etong letter boy, assigns tasks to staff members. Uy, ikaw sa VS, ikaw sa feeding, ganyan, ikaw sa meds. That's letter boy, functional nursing. Itong letter C, leads nursing staff in providing care to a group of clients. Ano naman ito? Team nursing. Ganon. So number 61, letter dog. 61, that's letter dog. Again, number 61, letter dog. 61 is dog. 62, Maxine attends an in-service educational session for staff and student nurses about case management conducted by the unit nurses manager. The clinical nurse manager determines that a review of the material needs to be done if one of the staff nurse stated that case management, that's letter dog, represents a primary health prevention focus managed by a single case manager. Okay, hindi po ito yung feature ng case management, but the rest is correct. Okay, 62, letter dog. 62, that's letter dog. 62, dog 63. Now the nurse manager in the said nursing unit is reviewing the critical paths of the clients. She collaborates with each nurse assigned to the clients and performs a variance analysis. Highlight natin variance analysis. Which of the following indicate the need for further action and analysis? That's letter boy. Purulent drainage is noted from post-op wound infection or incision rather. Okay? Para masagutan natin to ng tama, i-define muna natin ano ba yung variance. By the term itself, variance, ito yung actual deviation. Okay? Para nag-detour ka sa usual paths na ginagawa natin. Okay? Not all variants are negative. Meron po tayong positive variance na tinatawag. And kapag positive variance po ang pinag-uusapan, ibig sabihin, na-achieve ng patient natin yung maximum benefit na nakukuha niya sa care na binibigay natin. Okay, in other words, pwede siyang ma-discharge ng mas maaga kasi gumaling siya ng mas maaga. Okay, positive variance yon. On the other hand, when you say negative variance, okay, ito naman po yung mga untoward events or incidents na nangyari throughout the care that we give to the patient. Okay, so kung kanina sa positive variance, napaaga yung pag-discharge sa kanya. Okay, dito naman po sa negative variance, mas nagiging late, mas nade-delay yung discharge niya. Okay, ang sabi daw kasi indicate the need for further action. So there's something wrong sa variance niya. Okay, so negative variance yung hinahanap natin. Letter B yun. 63, that's letter boy. 63, letter boy. 63 is boy. 64, the nurse manager is planning to implement a change in the nursing unit from team nursing to primary nursing. She anticipates that there will be resistance to the change during the change process. The primary technique that she should use in implementing this change. Okay, the words that they use, primary technique. Okay, to avoid your resistance, that's letter apple, introduce the change gradually. Kesa kapag finorce mo yan ng isang bagsakan na ito yung sundin nating change, ma-overwhelm yan, mas lalong counterproductive yon. So 64 is apple. Introduce it gradually. 64 apple. 64 apple. 65, nursing assistant in the unit is resistant to the change and is not taking an active part in facilitating the process of change. Which of the following is the best approach of the nurse manager in dealing with the nursing client or assistant? Okay, we never ignore the resistance. We don't ignore. Okay, burahin mo na yan. We don't exert coercion. Di tayo nami-minute dito. Walang sapilitang mangyayari dito. Okay? X na rin yung letter boy. Provide a positive reward system for the nursing assistant. Okay? Temporary solution lang to guys. Mahilig tayo sa mga band-aid solutions eh. Iwasan natin yon. Hindi niya ma-address yung primary concern na nangyayari sa NA. Okay, so X din to. It's not the best answer. Letter dog, confront the nursing assistant to encourage verbalization of feeling regarding the change. Anong problema? Okay, i-share mo sa akin kasi baka ma-address ko or baka pwede kitang matulungan. Okay, 65, letter dog. 65, that's letter dog. Okay, 65, letter dog. 66, situation, 55-year-old patient. Uy, guys! Naulit na naman. Ito yung mga gusto natin. Yung mga naulit at the same time, alam natin yung sagot. Okay? 66 is apple. 67 is cat. Smooth muscle cell. 68 is apple, flaring. 68, flaring. 69, letter dog. Naulit na po ito. Okay? Number 70, biopsy. Letter C. 70, letter C, biopsy. 71. Mang Nardo 75 was brought to the surgical unit from PACU after a transurethral resection. So, i-highlight natin to. Usually, ang transurethral resection, okay, prostate ang problema. TURP yan. You are assigned to receive him. You noted that he has a 3-way indwelling urinary catheter for continuous fast drip bladder irrigation which is connected to a straight drainage. Okay? Latin na natin to. 71. Immediately after surgery, you expect the urine to be, that's pinkish to red. Pinkish to red. Medyo bloody pa siya. Okay, 71, letter dog. Pero guys, kapag bright red yan, ihi mo bright red, ano yun? Active bleeding, hemorrhage yan. So, i-refer natin sa doctor yan. Okay, 71, expect natin normal reaction, pinkish red. 71 dog, 71 dog, 72. The purpose of the continuous bladder irrigation, basically to avoid the clots. Basically, para ayaw mo ma-stock lang siya doon. Avoid stasis. Okay, asan dyan yun? Letter boy, provide continuous flushing of clots and debris from the bladder. 72, letter boy, para hindi siya ma-stock lang doon. 72, that's letter boy. Tsaka, yun na nga, flushing of clots. 72 boy, 73, nang Nardo informs that he feels some discomfort on the hypogastric area and he has to avoid. What will be your most appropriate action? Guys, ano yung cue natin? Subjective cue. O, kapag naka-receive ka ng subjective cue, you would want to assess further. Right? So, asan po dyan yung kaisa-isang assessment? That's letter dog. Note if there is a change in color and rate of outflow. Then refer to the urologist for possible irrigation. Okay, assessment. 73, letter dog. 73, that's letter dog. Again, 73, letter dog. 74, you decided to check on Mang Nardo's IV fluid infusion. You noted a change in flow rate, pallor, and coldness around the insertion site. Usually rin, nako-confuse yung mga students dito. What is the difference between your infiltration and your phlebitis? Okay, pag sinabi mong infiltration, ibig sabihin, yung cannula sa loob, yung IV cannula na pinasok mo, yung plastic cannula, okay, wala na siya sa blood vessel. Okay, lumabas na siya sa tissue, na-dislodge na siya. Yes, sir, ma, correct. Okay, yun yung infiltration. So kapag naramdaman mo yan, pag finil mo yan, malamig, cool to touch. At the same time, medyo manas na siya, guys. Huwag mo nang pilitin. Yung iba kasi alam mo nang manas na ayaw pa rin tanggalin. Okay? Huwag ganun. Mag-reinsert ka na lang. So kapag ganun, remove. Okay? Via your, dapat sterile technique. Hindi pala sterile technique, pero ayun, aseptic technique pala yung term. Aseptic technique. Okay, tapos mag-reinsert ka na lang ng bago. Pero kapag phlebitis ang pinag-uusapan, itis guys, inflamed na siya. So warm to touch tayo dyan. Warm to touch. Minsan painful yan for the patient. Masakit na, wag nyo na rin pilitin guys. Okay, kasi nagre-react na yung skin. Tanggalin mo na rin siya. Okay, so yun yung difference ng phlebitis to infiltration. Eh, ang tinatanong sa atin, coldness. So boy yan. 74, letter boy. 74, letter boy. 74 boy, 75. Knowing that proper documentation of assessment findings and interventions are important responsibilities of the nurse during the first op day. Which of the following is the least relevant to document in the case of Mang Nardo? Okay, again, least relevant daw. Anong nangyari sa kanya? Surgery, tapos first post-op day. That's letter dog. Activities of daily living started. Diba kapag first post-op day, gusto pa natin mag-anticipate ng complications, diba? So yung vital signs, yun muna yung inasikaso natin. Okay, letter C, amount, color, consistency. Okay, itong letter dog, bandang pa-discharge na to. Kapag na-make sure natin na okay, naka-adjust na si patient, yung katawan, okay, sa operation na nangyari, pwede mo nang simulan mag-health education with regards the ADLs of the patient. 75, letter dog. May timing din tayo ng mga interventions na ginagawa. 75, that's letter dog. 75, dog. Okay. 76, many hospitals form bioethical review committee to ensure the quality of life. You are invited by the nursing service department to participate in their bioethical review committee. You are expected to know the purpose and apply bioethical principles. Number 76, what is the purpose of this bioethical review committee? Guys, are you still with me? Okay lang tayo dyan? Okay pa. Pwede kayo mag-snacks or merienda kung gusto niya. Ha? Kain lang kayo dyan. Basta makinig lang kayo. Okay na sa akin yan. Tapos mag-notes. Okay? Alam natin guys, na kapag ethical issues ang pinag-uusapan, wala naman po tayong one-size-fits-all solution. Okay, wala rin tayong textbook answers kapag ethical issues ang pinag-uusapan. Bakit? Kasi case-to-case basis yan. Okay? And itong bioethical review committee, kailan sila i-enter? Okay? Saang situation sila i-enter? Kapag gulo-gulo na lahat. Okay, kapag sabihin natin kunwari, yung patient may trust issues na sa doktor niya, ayaw nang maniwala sa doktor, ayaw na rin maniwala sa nurse, tapos yung patient, di niya rin naman alam kung anong gagawin. Okay, iakyat mo na yun sa review committee, sa ethics review committee. Sila yung magde-decide. Okay? Minsan, kunwari, ini-impose, for example, ng doktor, yung gusto niya mangyari sa pasyente, siguro gusto niya sabihin na i-DNR mo na yan sa bantay. Ayaw pa ng bantay na ipa-DNR yung pasyente. Ethical concern yan. Yung mga ganon. Okay? And kailangan natin ng bioethical review committee, kung member ka niyan, it would help you, okay, to be exposed to different situations para mag-increase po yung judgment, yung level of, sabihin natin yung, level of judgment natin, mag-i-increase din. Okay, yung decision-making skills natin, mag-i-improve din. So that's letter C. Increase individual's responsibility for decision-making. 76, letter C. 76, that's letter C. Yun din yung kagandahan kapag mas marami kang experience, sabihin natin sa bedside. Kasi kapag mas marami kang experience, mas marami rin yung exposure mo with those kinds of situations. Okay, so 76, letter cat. 77, BADS who is admitted to the hospital with autoimmune thrombocytopenia and a platelet count of 20,000 develops epistaxis and melena. Treatment with corticosteroids and immunoglobulin has not been successful. Her physician recommended splenectomy. BAD states, I do not need surgery. This will go away on its own. Okay? In considering your response to BADs, you must depend on the ethical principle of letter C, autonomy. Okay, letter C, autonomy. Kung mapapansin nyo guys, napakahaba nung tanong. At the start of the statement of the question, parang med-surg related siya, di ba? So akala mo, ang itatanong sa atin, med-surg, but at the end of it, ethical question pala. Maraming ganitong tanong sa board exam. Noong time namin, okay, ganito rin kahaba yung statement niya. It's all about the OB. Okay? Pregnant woman. Tapos at the end of the statement, ang tinanong pala, okay, ethics din. Mga ganon. Or at the end pala, parang psych palang itatanong. Yung mga ganon. Okay? So dapat talaga, you have to read the question word by word until the end. Okay? That's letter C, autonomy. Ano pala tandaan natin para masagot yung autonomy? Basta merong decision-making involved yung pasyente. Okay? Whether or not gusto mo yung decision niya. Okay? Basta nag-decision siya, autonomy yon. Okay? Autonomy, decision-making. What about justice? Ano yung palatandaan natin kapag justice naman yung concept? So it talks about your correct, fair allocation, fair distribution, of your resources. And anong klaseng resources? Not only the material or physical resources. Okay? Pwede kang physical resources, pwede ka rin human resources. Yung staffing issue mo. For example, okay, nagkaroon ng sudden typhoon. So, nagkaroon ng baha sa isang city. Yung isang ward, kulang sila ng staff. Kasi yung mga staff dapat, sabihin natin for PM shift, na stranded sa place nila. Okay, so ang gagawin ng nursing admin, supposedly, hahanap sila ng ibang staff, available staff, okay, ipapag-relieve nila dun sa ward na yun. Yun yung justice in terms of your human resources. Okay, ano pa, kapag po ang concept pinag-uusapan, triage, justice yan. Ano pa, prioritization. Okay, justice pa rin yan. Fairness with your distribution of resources. For example, ER nurse ka naman. ER nurse ka, mami. Tapos, kailangan ng 5 patients ng mechanical ventilator. Pero guys, for some reason, 4 lang yung available. So, kanino mo ibibigay yung 4 na yon? Yun yung principle of justice. Okay? Resources. Pag sinabi mong beneficence, anong keyword natin dito? Doing good. Meron tong may kabaligtaran to guys. May kapatid to. Anong tawag natin sa kanya? Non-maleficence. Okay? Do no harm naman to. Pag nabasa mo yung non-maleficence na do no harm, tas beneficence na do good, parang niloloko lang niya ako, di ba? Parang, pinagbaligtad mo lang eh. So, paano ko malalaman which is which? So, ito yung secret natin dyan. Okay, pag sinabi mo non-maleficence, any nursing procedure involved in the situation. Okay, non-maleficence yun. Sabi natin do no harm eh. So, basta meron kang risk, okay, na mako-compromise yung safety ng pasyente, it talks about your non-maleficence. Eh di ba in every nursing procedure that we do, may risk of harm tayo dyan. Okay? Pag beneficence naman, ang pinag-uusapan, anong palatandaan natin dyan? Okay, pag mabait si nurse, guys, pag may halo siya sa ulo niya, okay? If the nurse shows compassion, if the nurse shows gentleness or care to the patient, yan yung mga beneficent situations natin. For example, the nurse is administering NGT feeding to the patient. Is that beneficence or non-maleficence? Beneficence, non-maleficence. NGT feeding, guys. Bene or non-male? Mas maraming non-male. Pero may nakikita akong beneficence. Okay. That's non-maleficence. Non-maleficence. What about the nurse is raising the side rails up of the patient? Is that beneficence? Non-maleficence. Hati ulit. May beneficence, may non-maleficence. Right? Raising side rails up. Still non-maleficence. Still non-maleficence. The nurse is the nurse is performing endotracheal suctioning to the patient. Beneficence, non-maleficence. Endotracheal suctioning. Yon, uniform na sila, guys. Okay, non-maleficence. Okay, non-maleficence. The nurse is performing lumbar tap to the patient. Alam nyo, uto-uto na naman kayo, guys. Nagpa-uto na naman kayo, guys. Ayan, so sumagot naman sila. Sumagot naman sila. Okay, malpractice is waiving. Okay, one day ka palang nag-duty doon, okay, na-revoke na yung license mo. Malpractice po yon. Nurses do not perform lumbar tap. Okay? Uy, wag kayong uto-uto, guys. Na-practice na natin to, guys, 'di ba? Wag na tayo maging uto-uto dito. Okay, na-practice na natin 'yan. Okay, next one. The nurse is holding the dying patient's hand. Ganon. The nurse is holding the dying patient's hand. I'm here at your side. You don't have to worry. You're not alone. Ganon. Beneficence tayo dyan. Beneficence, correct. The nurse is staying beside the patient during his panic attack episode. Bait ni nurse, guys. 14 ang patients niyan, pero nag-stay siya sa patient niya with panic attack. Okay, beneficence yan. Okay, beneficence yan. Okay, so I guess nakukuha niyo na yung difference ng beneficence and non-maleficence, but for sure, it takes practice. So, okay lang kahit hindi nyo pa siya ma-fully grasp ngayon. Okay? Pero, share ko lang sa inyo yung mga shortcuts natin para mas maintindihan natin. Kasi guys, ito talaga yung goal ko. Na-goal nyo na rin. Okay? Goal ko, na-goal nyo na rin. Okay? As much as possible, we would want to use, okay, lesser brain cells, okay, sa actual board exam. Hindi na tayo gagamit na masyadong maraming brain cells dito. Bakit? Kasi sa actual review, nagre-review na tayo, alam na natin yan. So medyo parang instinctive na yung pag-answer natin. Sagot na lang tayo ng sagot. But of course, with proper accuracy and analysis, okay, dapat tama pa rin yung sagot. Okay? Huwag tayo ututo, guys. Okay? Ayan. So 77. Okay, ito. Advocacy lang. Okay? When you say advocacy, daanan na rin natin. When you say advocacy naman, it talks about your ano Tagalog na? Ano English yun? Yung pinaglalaban mo, standing up for the patient's rights. Okay? So for example, si patient ay unconscious, tapos merong unreasonable na doctor, magiging voice ka niya. Correct. Merong unreasonable na doctor. You're there as an advocate for the patient. Yes, correct. Yun yung word, empowerment to the patient. Okay? Advocacy is empowerment to the patient. Okay? Yun lang yon. 78. Janelle is terminally ill and is experiencing severe pain. She has bone and liver metastasis. She has been on morphine for several months now. Okay? bone cancer is really one of the most painful cancers ever. Hindi ko pa siya na-feel, pero sa mga nababasa ko, sa mga nakikita ko, very kawawa ang patient with bone cancer. Okay? Journal is aware that they are having financial problems. She decides to sign a DNR form. Oh, yan, gagamit ka pa ba ng brain cell dito, guys? May decision making na nangyari, autonomy yan. Okay, 78, letter boy. 78, that's letter boy. 79, Cindy, a staff nurse, considered a role model, not only by her colleagues, but also by her patients. She goes out of her way to help others. Ito lang yung gusto nating makuha dyan. Okay? She's very active in professional organizations and practices what she teaches. What ethical principle is she practicing? That's letter C, advocacy. 79, letter C, advocacy. Number 79 po, advocacy. One more, 79, letter C. 80, are commuting to work riding the LRT. Older person collapse and nobody seems to notice her. Walang pakialam yung mga tao, pero ikaw, tumulong ka. Tapos apparently, nag-hypogly pala siya. And you were able to save a life and you felt good. That's letter boy, beneficence. Okay, doing good yan. 80, letter boy, beneficence. Again, 80, letter boy. 79 is letter cat. 79 cat, number 80 boy, 80 boy, 81, Brian G, 65 years old, was admitted due to end-stage renal failure. Ayaw tayong tantanan, guys, no renal problems natin, pero either way, sagutan na rin natin. Okay. 81, during the assessment of Brian's scheduled hemodialysis, the nurse hears bruit over the side of the AB graph. Ibig sabihin, patent po yung graph na yun. 81, letter boy. Kung ang bruit ay ino-auscultate, how do we assess for the thrill? How do we assess for the thrill? We palpate. Okay, we palpate. Huwag niyo pagbaligtarin na, pag thrill palpate, pag bruit auscultate yon. Yun yung parang wheezing sound niya. Okay, so 81, that's letter boy. 82, Mr. G has an ordered diet containing protein with high biologic value. An example of protein source with high biologic value. Ito na naman guys, letter C, eggs. Etong letter boy, nuts, etong letter dog, legumes, mga low biologic value lang yan. Gelatin, X yan. Protein ba ang gelatin? 82, letter cat. 82, cat. 83, the chart of Mr. G lists his dry weight as 61.36 kilograms. The term dry weight refers to, letter dog, the client's weight after dialysis. Or in other words, ano na po yung timbang ng pasyente pagkatapos mong tanggalin yung excess fluid sa katawan niya? Okay, 83, letter dog. 83, that's letter dog. 83, dog. 84, client's family member asks the nurse why the client on hemodialysis developed disequilibrium syndrome. The nurse's response should be based on the understanding that it occurs as a result of, letter dog, too rapid decrease in the BUN levels. Hindi makakip up yung katawan sa changes. 84, letter dog. Again, when we talk about your disequilibrium symptoms, think of your neurologic symptoms. 84, dog. 84, dog. 85, the nurse is assessing a client following hemodialysis. Which of the following findings indicates the treatment was effective? Letter C, fluid volume decrease. Nabawasan yung manas ng pasyente. Yung pagiging edematous niya nabawasan. 85, letter C. Nakakatawa minsan kasi meron na-admit sa ward. As in, manas kung manas. Tapos after 2 weeks na parang everyday ka nabibigay ng furosemide, every 8 hours, pumapayat na talaga sila. Wala lang, share ko lang. Kasi ang saya sa feeling, kapag nafe-feel mo yung, kapag nakikita mo, yung parang improvement ng pasyente. Tapos kapag nadi-discharge sila. Okay, 85, letter C. 85, that's letter cat. 86. Situation, breast cancer is the second most common type of cancer after lung cancer, 99 of which occurs in women. Survival rate is 98% if detected early and promptly. Marian is a 55-year-old patient, high risk for breast cancer, recently diagnosed. Okay, highlight natin. All of the following are factors that are said to contribute for the development of breast cancer except one. Okay, letter dog, prolonged intake of tamoxifen. Prolonged intake of tamoxifen. Actually, ang tamoxifen, prescribe ito kapag may breast cancer yung patient. Meron din ako mga nababasang articles na pwede siyang gamitin as prophylaxis against breast cancer. So, hindi siya nagko-contribute to the development. Treatment siya. Okay, 86, that's dog. 86, that's letter dog. Isa pa po, 86 is dog. Wait lang. Ang estrogen, sabi kanina, not affected for cancer. Baliktad. Okay, progesterone, yung protective factor. So, ibig sabihin, yung estrogen, it contributes. So, kapag may frequent use ka ng contraceptive na walang progesterone, so it increases your risk to have your cancer kasi exposed ka sa estrogen. So, kapag progesterone, yun yung protective. Huwag niyo pagbaligtarin, ha? Yan. So, 86, that's letter dog. Number 80. Nagets mo yun, sir? Sana okay tayo. Okay, 87. Protective factors for the development of breast cancer are the following except. Ma'am, bakit humihina yung boses ko? Ito, nalalakasan ko na. Okay, except what? Ilagay natin dito negative sign. Kasi negative yung hinahanap mo, yung naiiba sa choices. Letter dog, alcohol intake. In fact, predisposing factor to, hindi siya protective. Okay, 87, that's letter dog. 87 is dog. 88, patient diagnosed with breast cancer has been offered the treatment choices of breast conservation surgery. When questioned by the patient about these options, the nurse informs the patient that the lumpectomy with radiation, that's letter boy, 10-year survival rate as the modified radical mastectomy. Okay, 88, letter boy. 88, that's letter boy. 89, Marian asked the most appropriate time of the month to do her self-examination of the breast. The most appropriate reply by the nurse would be, balikan natin yung edad ni Marian, 55-year-old. So expect natin, uy, baka postmenopausal na si mother. Okay, same day each month. 89, letter dog. 89 is dog. 90. Marian is being treated with radiation therapy. What should be included in the plan of care to minimize skin damage from the radiation therapy? Letter dog, avoid applying cream and powder to the area because the area itself is sensitive enough. So kapag naglagay ka pa dyan ng kung ano-ano, baka ma-trigger natin yung inflammatory response. Mas magpo-produce siya ng symptoms such as redness or irritation, ganyan. So 90, letter dog. 90 is letter dog. Okay, 90 dog. 91, based on the DOH and WHO, mainstay early detection method is recommended by developing countries monthly BSC and annual health worker breast examination. So ano yung significance nito? Okay? Alin? This one. For comfort. To reduce the discomfort. So hitting pad tayo. Ayan. So ano yung significance nitong letter apple? Kasi meron kang cue, okay, na ikaw as a patient. Okay, meron ding details or meron ding assessment yung physician. So kapag pinag-combine niyo yun, mas mako-correlate niyo yung observations niyo together. Okay, mas ma-analyze niyo yung parang prognosis, okay, or yung actual na condition, okay, mas okay yung management kapag ganon. So 91, letter apple. So kapag pinagsama yung dalawa yung observation ninyo, mas okay yung magiging diagnosis, mas magiging accurate siya. 91 is apple. 91 apple. 92, the purpose of performing the breast self-examination regularly is to discover, letter dog, changes from previous BSE. Okay, changes from previous BSE. Uy, bakit ngayon may lump? Eh, dati wala naman. So 92, letter dog. 92, dog. 93, if you are to instruct a postmenopausal woman about BSE, when should you tell her to do BSE? Guys, postmenopausal on the same day each month. 93, apple. 93 po, that's letter apple. 93 is apple. Number 94. During breast self-examination, the purpose of standing in front of the mirror is to observe the breast for, letter dog, changes in skin and contour. Okay, 94, letter dog. 95. When preparing to examine the left breast in a reclining position, the purpose of placing a small folded towel under the client's left shoulder, that's letter C, to balance the breast tissue more evenly on the chest wall for a more precise, accurate assessment. 95, letter C. 95, letter C. 96, radiation therapy, another modality of cancer management with emphasis on multidisciplinary management. Okay, you have important responsibilities as a nurse. John is receiving external radiation therapy and he complains of fatigue and malaise. Okay, which of the following nursing interventions would be most helpful for John? We would want to address the fatigue as the chief complaint. So that's letter dog. Help him plan his activities. Okay, dapat spaced out yung activities na gagawin natin sa kanya. Dapat i-consider mo rin yung rest periods para sa kanya. Okay? Ang brachytherapy, guys. Narinig niyo na ba yung brachytherapy? Is that internal radiation or external radiation? Internal or external? Internal. Okay, internal. Meron siyang kabaligtaran. Yung external, teletherapy naman yung tawag sa kanya. Okay, teletherapy naman yung tawag sa kanya. Okay, once you have that radiation source inside of you guys, pwedeng pellets, okay, ibig sabihin, you are a continuous source of the radiation. Okay? So ano yung mga nursing intervention natin doon? Dapat as much as possible kung admitted yung pasyente, okay, yung room na ipoprovide natin sa kanya, okay, as far as possible. Okay? Ano pa? Dapat mag-isa lang siya dun sa room. Dapat wala siyang ibang roommates. Dapat wala siyang ibang patients na involved. Of course, yung lead shield, okay, as a nurse, kapag mag-interact ka sa patient. Okay? Kapag naman external source ng radiation, once natapos na yung external radiation therapy mo, wala na. Hindi ka na rin source ng radiation. Yun yung pinagkaiba nila. Okay? So, yun. 96 is letter dog. 97, immediately following radiation teletherapy, John is letter dog, free from radiation. Free from radiation. 97, that's dog. 97 po dog. 98, John is admitted with radiation-induced thrombocytopenia. Cytopenia. As a nurse, you should observe which of the following symptoms, letter apple, petechiae, ecchymosis, epistaxis. So, dapat, yung presenting symptoms mo, i-correlate mo sa thrombocytopenia. Okay? Decreased ang platelet count. 98 apple. 98 apple. 99. Which nursing diagnosis should be of highest priority? Letter C, impaired tissue integrity. Given your symptoms that you have, petechiae, ecchymosis, epistaxis. Okay, so letter C yan. Impaired tissue integrity. Last number, 100. What intervention should you include in your care plan? That's letter apple. Inspect his skin for petechiae, bruising, or bleeding regularly. 100 apple. Questions so far? Are we clear so far? Yun na lang ang tanong ko. Are we clear? Okay tayo? Sabihin nyo kapag hinihingal na kayo, guys. 99-100. Parang, ma'am, wait lang, hinihingal na ako sa'yo. Rest ulit. Ha, sabihan niyo ako. So, tawid na tayo to NP5. Okay, so ang pinagkaiba po ng brachytherapy, internal radiation. Yan. So, pag sinabi mo internal radiation, yung radiation source nasa loob mo. Okay? Pero kapag teletherapy, external radiation, this is the usual, for example, nagpa-x-ray ka. External yon. Di naman pinasok sa yung radiation source. Ganon. Okay, so tawid na po tayo, guys. We're down to the last material. This is your NP5, guys. And hopefully, sana po marami kayo natututunan up to this point. If you have any questions, pakihabol na lang po para masagutan natin. Okay? If you would notice, NP1, ang heavily concentrated concept dyan, CHNCD, NP2, OBpedia, 100, ayan. NP3, NP4 would be the med-surg, NP5 would be psych. Okay, aside from the psych, yung mga neuromuscular conditions natin sa med-surg, pwede rin lumitaw dyan. Okay, so yun yung mga i-expect natin. Okay, sige. Balikan lang daw po mabilis, yung number 90. This one. To minimize the skin damage from radiation therapy. Actually, kahit wala ka pang nilalagay dyan, possibly magkakaroon siya ng redness as a side effect of your radiation therapy. So gusto mo, ma-preserve natin, okay, ma-maintain natin na intact yung skin kung saan nag-radiation. So avoid applying your cream and powder to the area to minimize, okay, or to avoid the possibility na ma-compromise natin yung skin integrity. Ganon, 90 letter dog. Okay. So tawid na tayo guys, finally. Okay, number 1, NP5 guys, NP5. The client diagnosed with borderline personality disorder is admitted to the unit after having attempted to cut her wrists with a pair of scissors. Ayan. Self-mutilation. The client has several scars on both arms from self-mutilation and suicide gestures. A staff member states to the nurse, it's just attention that she wants. She's not going to kill herself. Okay? Whether or not, guys, kahit ano pa yung intention ng psych patient natin, kung bakit siya naglalaslas, okay? I-attend mo pa rin, lapitan mo pa rin. Kasi paano kung tinotoo niya? Tas wala ka doon. O malpractice sa part mo yon, negligence sa part mo yon. Okay? So any attempt at self-harm is serious and safety is a priority. Number 1, letter dog. Sabihin natin na okay, sige, attention seeker siya, kaya siya naglalaslas. I-address mo rin yung concern na yon. Okay? Sa bawat behavior ng pasyente, may corresponding response tayo or intervention for that. I-maximize natin yon. So number 1, letter dog. Okay, number 1, letter dog. Number 1, letter dog. Number 2, the nurse assesses a client to be at risk for self-mutilation and implements a safety contract with the client. We do this, right? Which of the following client behaviors indicate that the contract is working? That's letter boy. The client notifies the staff when anxiety is increasing. Okay? One of the reasons why, kung bakit nag-self-mutilate yung patients natin, kung bakit sila nagka-cut, is because of the anxiety itself. Okay? So, kapag meron tayong kontrata, and we want to honor that contract, okay? Tapos si patient, she or he would approach to you and say na, uy, tumataas po yung anxiety ko. Feeling ko maglalaslas na ulit ako. It's a positive indication that the contract is working. Ibig sabihin, anong tawag dito? Participative si patient with regards to contract that you did together. Okay, so number 2, letter boy. Number 2, that's letter boy. Number 2, letter boy. Minsan kasi to address that emotional pain, physical pain na lang yung gagawin nila. Okay, so number 2, that's letter boy. Number 3, the client with histrionic personality disorder is melodramatic and responds to others and situations in an exaggerated manner. Yun yung key feature ng histrionic patients natin. OA sila. Okay, attention seekers sila, mga papansin, mga napaka-flamboyant outfits. Okay, the nurse should recommend which of the following activities for this client. Okay, gusto natin, yung energy na meron sila, gamitin nila sa tamang activities, such as letter dog, role-playing. Okay? Of course, hindi naman nonsense yung role-playing na ipapagawa natin sa kanila. I-analyze natin, i-explore natin after. Okay, kung bakit ganun yung behavior nila towards that certain role that they have. Okay, so andun pa rin yung therapeutic management as a nurse. Number 3, letter dog. Number 3, letter dog. Number 4, when assessing a hospitalized client diagnosed with major depression and borderline personality disorder, the nurse should ask the client about which of the following first. Guys, okay, prioritization of your intervention or of your assessment. Letter C muna. Thoughts muna, bago plano. Okay, iniisip mo bang magpakamatay? Okay, may plano ka na bang magpakamatay? Okay, and the way that we would handle these types of students, of patients rather, it has to be direct. Okay, confrontational, yes or no. Okay, 4, letter C. Number 4, letter cat. Sa pa po, number 4, letter cat. Number 5, 4-month-old child is brought to the clinic for the next set of immunization. Highlight age of the child. Ano pa? Yung gagawin sa kanya. receiving immunizations, contraindications. Okay. Letter D. For me, it's thoughts muna. Would take the priority. Tapos letter D, plans tapos yung seriousness na after. Because, bakit gusto nating malaman yung seriousness? Kasi para malaman din natin, ano ba yung level ng suicidal precautions yung kailangan nating i-implement dito sa patient na to. Okay, I think 4 letters C. Okay, number 5, contraindication, letter dog, active infection. Aside from active infection, ano pa yung ibang contraindications? Immunosuppression. Ano pa? Patients na gumagamit ng corticosteroids. Corticosteroid therapy. Yan yung mga contraindication natin. So number 5, letter dog. Number 5, letter dog. Seizures, correct. Sama natin. Seizures after the first dose of giving that certain vaccine. Ayan. So number 5, that's letter dog. Correct. Okay. Number 3 po, that's dog. Role playing. Number 3, letter dog, role playing. Number 4, C. Number 5, dog. Number 6, the client is given the hepatitis B immune globulin serum, guys. Ito yung sinasabi ko sa inyo na kapag passive immunity ang pinag-uusapan, it's either antitoxin or immunoglobulin. Ano yung purpose niyan? It offers a immediate protection. Number 6, letter cat. Although immediate siya, hindi po siya lifetime. So limited lang yung effectiveness niyan. Short-lived lang yan. Okay, passive immunity, short-lived immunity. 6-letter cat. 6-letter cat, number 7, what common adverse effects will the nurse tell the client may be experienced after being given hepatitis B immune globulin? Guys, IM. Okay, route of administration, letter dog. Pain and tenderness at the injection site. 7-letter dog. 7, that's letter dog. Number 8, college freshmen are participating in study abroad program. When teaching them about hepatitis B, the nurse should instruct the students on. Okay, so hepatitis B, actually considered din natin to as an STD. Sexually transmitted disease din po yan. So that's letter dog, safe sexual practices. Okay, number 8, letter dog. Letter apple, water sanitation. Ano to? Hepatitis A, hepatitis A. Okay. May vaccine na ba for hepatitis T? Wala pa naman. So, X tong letter C. Okay. Isolation, kaya single dormitory rooms. Kapag hepatitis B, hindi naman kasi bloodborne siya. So, letter dog talaga yung sagot. Number 6, that's cat. 6, that's cat. Number 8, dog. Number 9, which of the following is normal for a client during the icteric phase of viral hepatitis? When you say icteric phase, okay, yun yung para acute phase na hepatitis natin. Letter boy, yellowed sclera. Okay, in the first place, paano ba ito nangyayari? Number 6, that's cat po. 6 is cat. Number 7, that's dog. 6 cat, 7 dog. Okay. When you have your liver inflammation, possibly secondary to your viral hepatitis, okay, isa sa mga nangyayari, basically, no-obstruct mo rin yung flow ng bile. Okay, yung flow ng bile. So kapag meron kang excessive na bilirubin sa katawan, nagiging jaundice ka dyan. Okay, so magkakaroon ka ng yellow sclera at the same time, okay, ang kulay ng urine mo, it's not actually light, dapat dark to. Okay? Ang tarry stools natin, GI bleeding yan, hindi naman siya expected sa hepatitis. Shortness of breath, hindi naman to expected sa patient with hepatitis. Okay, so number 9, letter dog. Number 9, letter dog. Anong ginawa ko? Balik tayo, number 7. Okay, letter dog pa rin. Okay, letter dog pa rin. 7 is dog. Number 8 is dog. Number 9, boy. Okay. Number 10, the nurse is planning a home visit for a client with hepatitis A. In order to prevent transmission, the nurse should focus teaching on letter apple, proper food handling. Okay, proper food handling. Itong letter boy, letter cat, and letter dog, pwede natin itong ipasok sa hepatitis B, C, and D. Okay, so letter, or number 10, letter apple, yan. Orofical. Okay, number 10, that's letter apple. Number 11, the nurse develops a teaching plan for the client about how to prevent the transmission of hepatitis A. Kasi sabi lang natin po, orofical, right? So that's letter C. Tell family members to wash their hands frequently. 11, cat. 11, letter cat. Well, the nurse is preparing a community education program about preventing hepatitis B infection. So ano daw yung incorporate natin sa health teaching? That's letter dog. The use of a condom is advised for sexual intercourse. 12, dog. 12, dog. Hepatitis B, relatively uncommon. Common yan. Okay, frequent ingestion of alcohol, not really related. So cancel. Burahin. Good personal hygiene habits. Baka letter A ang ibig mong sabihin. Okay, so 12, letter dog. 13. What is the most important for the nurse to teach a client newly diagnosed with genital herpes? Letter apple. Use condoms at all times during sexual intercourse. Number 10. Wala daw nakasulat na HEPA A sa forms. O paano ba yan? O, i-bonus natin. I-bonus natin yan. Okay, pero pakisulat na lang po sa notes ninyo that we are talking about your hepatitis A. Okay? Pag Hep A, letter apple lang sagot. So 10, supposedly apple, pero i-bonus na lang natin. Okay? Thirteen apple. 13 is apple. 14, nurse is planning care for a 25-year-old female patient who has been diagnosed with HIV infection. The client asks the nurse, how could this have happened? The nurse responds to the question based on the most frequent mode of HIV transmission, which is letter dog. Okay, having sexual intercourse with an HIV positive person without using a condom. 14, dog. Alam niyo ba ang incubation period na HIV? It could go for as long as 10 years. 10 years, guys, wala kang symptoms, tsaka lang siya lumabas after 10 years. Ganun yung isa sa mga feature na HIV natin. I had a patient before, okay, after 4 years, tsaka lang lumabas yung sintomas ng HIV. At hindi niya po yun nakuha. Secondary to sexual intercourse. Saan niya siya nakuha? Okay, sharing of needles. Okay. They were using, nagpapatato sila. Okay, sila tsaka yung tropa niya, nagpatato. Guys, apparently, hindi naman sa professional. So, naghiraman sila. Okay? So, that was year 2017 according to the history. After 4 years pa lumabas. Tapos minsan, kapag lumabas ang HIV symptoms natin, complications na agad. Okay? So, you have to manage it as accurately as possible. So, 14, that's letter dog. 14, dog. 15, in educating a client about HIV, the nurse should take into account the fact that the most effective method known to control the spread of HIV, of course, that's education. Letter dog. Health education. Health education. 15, letter dog. 16, the typical chancre of syphilis appears as, letter C, painless moist ulcer. Okay? Painless moist ulcer. May discharge ito, guys. Yung discharge po ng chancre, although painless siya, that's very, very highly infectious. Okay? So 16, letter C. Hindi siya makate. Oo, it's painless and usually it does not itch. Kaya usually itong chancre, hindi siya na-diagnose agad kasi hindi naman siya pinibigyan ng pansin ng patient natin. na may ulcer na pala siya, pero hindi niya pa nafe-feel, o hindi siya makate, not a cause of concern. Parang ganon. So 16, letter C. 17, the nurse is interviewing a client with newly diagnosed syphilis. In order to prevent the spread of the disease, the nurse should focus the interview by letter boy, contact tracing. Okay? List of sexual contact. Contact tracing. Of course, syempre, kapag na-trace mo yung mga contacts niyan, ipa-screen mo na for possible STD. Baka meron din sila. 17, letter boy. 17, letter boy. 17, boy. 18, when educating a female client with gonorrhea, the nurse should emphasize that for women with gonorrhea may not cause symptoms until serious complications occur. 18, letter dog. Hindi sila aware, sila mismo na may gonorrhea na pala sila. Kaya, unless maging severe form na siya, magkakaroon na yan ng pelvic inflammatory disease, okay, or things like that, related to that. So 18, letter dog. 18, letter dog. 19, the parents of an 18-year-old preparing to enter college ask if their daughter should have meningococcal vaccine for meningitis. The nurse tell the parents, letter C, let's review your records. The vaccine may already have been given a few years ago. 19, letter cat. Okay, 19, letter cat. 19, cat. Number 20, during the acute stage of meningitis, 3-year-old child is restless and irritable. Which of the following would be most appropriate to institute? Knowing na meron siyang symptoms na ganito, being restless and irritable, guys. Siyempre, ayaw mo naman magkaroon ng another sensory stimulation. Letter boy, keeping extraneous noise to a minimum. 20, letter boy. Okay, 20, letter boy. Because they tend to be hypersensitive to the noises and to the lights. So 20, letter boy. 21. Joshua, 35-year-old farmer, unmarried, confined in National Center for Mental Health with diagnosis of schizophrenia. Highlight ko lang to, guys, age niya. Ano pa? Highlight ko yung diagnosis. Letter dog, projection. Most common defense mechanism, letter dog, projection. Putting the blame into others. 22, Joshua says to you, the voices are telling me bad things again. Your best response is, letter C, I do not hear the voice you say you hear. Okay. Acknowledge the presence na may naririnig siya, but then reorient the client back to reality, present reality. Hindi ko naman naririnig, or hindi ko po naririnig yung mga naririnig mo. 22, letter cat. 23, relevant nursing diagnosis. 4, patients with hallucinations, letter apple, sensory perceptual alteration. Kapag hallucination ang issue, sensory alteration. Okay, kapag delusions ang issue, thought process yan. Okay, so wag na kayo magpapalito, guys. Sensory alteration, hallucination, altered thought process, delusion. 23, letter apple. 23, letter apple. 24, during mealtime, Joshua refused to eat, telling the food was poison. The nurse should, letter boy, offer him food in its container. Isa sa mga feature ng patients with paranoid schizophrenia, syempre trust issues, guys. Okay, may suspicions sila, guys. So hayaan mo siya yung magbukas ng pagkain niya para lang ma-make sure na hindi natin siya nilalason. Okay, 24, letter boy. Gusto ko yung tanong niyo sunod-sunod. Parang nagkasundo kayo. Ano guys? Send ko na to? O send natin sabay? Ganon. Okay? Sige, balikan natin. 22, the voices are telling me bad things again. Okay? This one is auditory hallucination. So the best priority for that, okay, I do not hear. Okay, presenting the reality. Magkaiba kasi yung hallucination sa delusions. Kapag may delusions yung pasyente na may nagsasabi sa akin na ganito, that is the time na i-explore mo yung meaning nun. That is the time na i-explore mo yung kung kaninong boses yon. Pero kasi ito, hallucination ito. Okay? Pag delusions, doon tayo nag-explore ng content. Okay? So this one, the best answer still pa rin, letter C. Yun yung difference nilang dalawa. Okay, 22, letter C. 23, letter apple. 24, boy. 25, when communicating with Joshua, the nurse considers the following except, that's letter boy, be warm and enthusiastic. Okay, 25, letter apple. Except ang tinatanong. Okay, so ilagay natin dito, negative sign. Bakit ayaw natin maging friendly sa patients with paranoid skits? Kasi akala nila, okay, akala nila may kailangan ka sa kanila, kaya ka ganun ka-friendly. So as much as possible, be direct, okay? Be formal when dealing with patients with paranoid schizophrenia. Okay, 25, letter apple. 25, letter apple. If recurrent yung false beliefs, if recurrent siya, delusions yon. Okay? Situation, Bruno seeks psychiatric counseling for his ritualistic behavior of counting his money as many as 10 times before leaving home. So this one, ano to? Anong tawag dito? Obsessive compulsive. Ay? Disorder. Magkaiba po yung OC na personality sa obsessive compulsive disorder. Okay, kapag sinabi mo OC na personality, sila yung mga perfectionists. Ito guys, pathologic na to, so disorder na siya. Okay, what is the most appropriate initial nursing diagnosis? Letter boy. Ineffective individual coping. 26, letter boy. Meron silang anxiety to begin with, pero hindi nila alam kung paano siya i-handle. Okay, meron silang defective na coping mechanisms. 26, letter boy. 26, that's letter boy. 27, OCD is best described by letter cat. Recurring unwanted, disturbing thoughts, alternating with behavior. 27, that's letter cat. Okay? Pag obsessive, guys, it talks about your thoughts, recurring thoughts. Kapag compulsive, it talks about your recurring behaviors or actions. Okay? Ganyan. So 27, letter C. 27, letter C. 27, letter cat. 28, the defense mechanism used by persons with OCD is undoing. And it is best described in which of the following statements? Okay, that's letter C. Something unacceptable already done, symbolically acted out in reverse. For example, para lang mas magets nyo ng maigi. Okay, si Otin guys, isa siyang nurse. Yung special guest natin sa Otin, okay? Si Otin, nurse siya. Night shift nurse. Meron siyang kapatid, si Inigo. Okay, kapatid niya si Inigo. Okay? Si Otin, nung paalis na siya ng bahay, kasi nga po night shift siya, naiwan niyang bukas yung electric fan sa sala set. Natutulog si Inigo. So apparently, nag-overheat po yung electric fan, nasunog po yung bahay nila. Okay, nasunog din si Inigo kasama ng bahay. So nadads yung kapatid niya. So sobrang guilty siya sa nagawa niya, guys. Okay? So the next time naaalis siya, ang tendency niya, isasara niya na 10 beses paulit-ulit yung electric fan to make sure na napatay niya na siya or natanggal na siya sa saksakan. Okay, yun yung undoing na tinatawag. Doon din nanggagaling, okay, yung parang history ng pagiging OCD ng isang tao. Okay, something unacceptable already happened, hindi na niya mababalik kung ano yung nangyari. So in turn, uulit-ulitin na lang niya yung what could he have done. Okay, to avoid it to happen. 28, letter C. Okay, so that is your defense mechanism undoing in the context of your OCD. 28, that's letter cat. 28, letter cat. 29, to be more effective, the nurse who cares for persons with OCD must possess which of the following qualities? Letter boy, consistency. Okay, consistency. 29, letter boy, consistency. Merong mga rituals yung patients with OCD. Okay? Washing hands 10 times bago kumain. Kapag nahuli mo siya sa akto na ginagawa yung rituals, should we stop that patient or should we interrupt that patient? Tumawad ka na, pwedeng 8 times muna. Tapos, susunod naman yung 2, ganon. Hindi po pwede yun. Huwag mo siyang papakialaman. Okay, that is his or her way to relieve the anxiety. Hayaan mo lang. Okay, hayaan mo lang. Gradual yung pag-alis natin dun sa rituals ng patient. Kapag nata-target natin yung roots or yung, tama, yung primary cause kung bakit siya nagkakaroon ng anxiety, over time, mawawala din yung ritual na yon. Okay, kung hindi man mawala altogether, mababawasan siya. Okay, so 29, that's letter boy. Consistency. 30, persons with OCD usually manifest letter dog anxiety. Anxious patients. 30 is letter dog. May anxiety sila tapos hindi nila ma-manage ng maayos. 30, that's dog. 31, patient who is depressed will undergo electroconvulsive therapy. Highlight. 31, studies on biological depression support ECT as a mode of treatment. The rationale is, letter C, ECT relieves depression psychologically by increasing the norepinephrine level. 31, letter K. Okay. Di ba parang joke-joke lang yung ibang choices? Massive brain damage, o walang ganun. Symbolic punishment, o walang ganun. Okay, letter dog. Life-threatening experience, depressed patients, mobilized body defenses, wala rin ganito. Okay, halatang ginawa-gawa lang yan. 31, letter cat. 31, letter cat. Number 32, preparation for a patient for ECT ideally is most similar to the preparation for a patient for general anesthesia. That's letter C. Gano'n siya ka-similar? Meron tayong pre-op medications na ibinibigay. For example, atropine. Para sa yung atropine? To reduce the salivation episodes. To avoid your aspiration. Okay, ano pang binibigay natin? Sedatives. Ano pa? Anesthesia mismo. Okay, so 32, letter C. 32, that's cat. 32, letter cat. I'm not really sure kung kailangan i-restrain ang patient with ECT. Parang not a fundamental requirement kapag ECT siya. But you just have to maintain the safety while doing it. Okay? Parang not necessarily i-restrain. Okay? 33, which of the following is a possible side effect? Yes. Kasi baka ma-injure pa siya lalo. Okay? Side effect which you will discuss with the patient, that's letter dog po. Confusion, disorientation, short-term memory loss. 33, dog. 33, that's letter dog. O, kapag ito yung nafe-feel niya, yes, oo. Sedation, may sedatives din po kapag ECT. Correct. Pag ito yung nafe-feel niya, okay, to reduce din yung episodes ng agitation, baka mag-agit siya during the procedure. So, i-sedate natin yung patient. Okay? I-present mo lang ulit yung reality. Present reality. 33, letter dog. Okay? 33, that's letter dog. 34, informed consent is necessary for the treatment of involuntary clients. If this cannot be obtained, permission may be taken from the letter C, next of kin or guardian. 34, letter C. Meron akong patient before, okay, na-admit siya sa ER, medyo ano na siya, medyo may complications na siya. Okay, sige. Okay, sige. Ikwento ko muna to. Meron siyang, may complications na siya. So, pinapirma na siya ng DNR, ng resident, habang ano pa siya, alert and awake and conversant. Nagpirma siya ng DNR, guys. Apparently, nung naging unconscious na siya, yung tipong life and death situation, dumating yung live-in partner niya. Yun yung naging bantay ng pasyente. Okay? Sabi nung live-in partner, pag nag-code daw, kapag tumigil sa pagtibok ng puso yung pasyente, ibomba pa rin daw, i-code pa rin daw. Okay? It's very clear na pumirma na nga ng DNR yung pasyente. Okay? May laban ba yung live-in partner doon? Sino masusunod? Yung patient o yung live-in partner? Patient or live-in partner? Is the patient. Wala siyang habol doon kapag legal ang issue natin. Okay, ang sinasabi kasi nung live-in partner niya, asan ba yung papel na pinirmahan? Patingin nga. Tapos sabi niya, hindi naman ganito yung pirma ng asawa ko. Sabi niya gano'n. Okay, so sabihin na natin na baka nga finorge o sabihin natin baka si finorge, kinonsider ng residente yon. Okay, wala pa ring laban yung live-in partner, hindi pa rin siya magde-decide. Okay, sino magde-decide? Yung live-in partner o yung nanay ng pasyente? Nanay or yung live-in partner? Sabi no live-in partner, wag niyo nang tawagan yung nanay, wala naman kasing pakialam yan. O asan siya ngayon? Ako yung nandito. Okay, wag niyo na tawagin yung nanay. Okay, but syempre wala pa rin kasing habol in terms of legal issues pag live-in partner, hindi sila kasal. So mother pa rin. And ang decision ng mother, she supported the decision of the, hindi ka naman wife girl. Okay? Babae po yung patient. Okay? Hindi ka naman husband, boy. Ganon. Dapat. Okay? She supported the decision of the daughter. So nagpa-DNR na lang din eventually. Okay? Actually kasi in the middle of that chaos, guys, napaka-chaotic talaga nung araw na yon. Natatandaan ko talaga. Nag-code pa yung pasyente, Diyos ko. Nag-code siya. Wala pang isang concrete decision. Nag-code pa kami. Okay? Nag 2-minute cycle pa kami. Tapos na-revive naman. So after nun, nagpa-DNR na rin. Okay? So ganun, pag live-in, wala pa ring habol. What if kinasal, sa Pilipinas, kinasal, tapos nag-separate, nasa Mindanao yung asawa. Okay? Tapos unconscious na yung asawa. Sino masusunod? Yung asawang nasa Mindanao or yung magulang? Yung asawa na naghiwalay, Philippine setting to guys, or yung magulang? Habulin mo yung asawa, mami. Ganon sila ka ano, ganon sila ka, tawag dito? Ganon sila ka strict when it comes sa legal matters. Okay? Paano po pag di sumang-ayon yung nanay, gustong i-revive yung patient? Doon sa ano, sa allegedly na DNR na sinign ng patient mismo. Okay? In the works, guys, i-confirm pa mismo kung tama ba na signature talaga yung patient. So for the meantime, yung mother pa rin yung masusunod. Okay? Paano kapag hindi na makontak? Ay, may way sila. Kasi hinahabol siya ng social worker para lang sa decision. Pag gano'n, minsan they could go as far as that intervention. Next of kin. Na. Okay. Pag hindi na talaga makontak, na wala na, for years na, yung magulang na, yung masusunod. Ganon. Carry, so 34, that's letter C. What if emergency situation, nabundol ng motor, emergency situation, siya lang mag-isa, pauwi na sa bahay, walang makontak, wala siyang ID. Wow, inuunahan mo ako. Wow. Tama ka naman. Yes, physician, doctor, ang magde-decide. Okay, paternalism ang pinapractice. Uy, ang gagaling niyo talaga. Special mention kayo kay Sir V kapag nagpakwento siya. Ang galing po na section na to. Parang ganun. Okay, ayan. So 34, still letter C pa rin tayo. Paternal. Okay, so move on. 35. After ECT, what should the nurse do before giving the client food, fluid, or medication? Letter apple, assess the gag reflex. Kasi nga, sinupress natin yung gag reflex niyan. Okay? To avoid aspiration, gusto lang natin ma-make sure na okay na ulit yung gag reflex bago tayo magpakain. 35, letter apple. Okay? 36. Looking at Mrs. Mendoza, 52 years old, teacher, myasthenia gravis. Your assessment would include the following exam. Ayan. Let's talk a little bit about your myasthenia gravis. This is a type of your neuromuscular medical condition. Ano pang isang feature niyan? Autoimmune po siya. Okay? Autoimmune yan. Okay? The very first signs na makikita natin sa pasyente na, uy, baka may MG ka na, okay, is the drooping eyelids. It's what you call your ptosis, correct? Okay, aside from your drooping eyelids, okay, ano pa? Itong mga special terms na to, yung mga muscles, weakness ng levator palpebrae, weakness ng ocular muscles, okay, nystagmus even, eye affectation, right? Except letter boy, difficulty of hearing. Medyo hindi siya related masyado kapag MG ang pinag-uusapan. Okay? So 36, that's letter boy. Ano issue nito? Yung acetylcholine, guys, hindi siya masyadong makadikit sa receptors niya. O yun. So nagkakaroon tayo ng weakness, muscular weakness as a presenting symptoms. 36, that's letter boy. 37, in an effort to combat complications which might occur, relatives should be taught. Ibabalik lang natin na ang issue po ng neuromuscular, ng yung myasthenia gravis is a neuromuscular condition. Pero hindi naman tayo muscles sa respiratory system, guys. And kapag yun po yung affected, especially the diaphragm, nako-compromise natin yung airway and breathing ng patient. So, mag-oxygen, na tayo, support dyan. 37 dog. 37 dog. Administration of oxygen inhalation. In severe cases, baka napa-intubate na yung patient. Pag ganyan. 37, that's letter dog. 37 is dog. 38, drug of choice for her condition, that's prostigmine. Okay, prostigmine. 38, letter apple. So kung yes, correct. Anticholinesterase natin. Okay, so 38, that's letter apple. Tingnan natin tong 39. As her nurse, you have to be cautious about administration of medication. If she is under-medicated, this can cause, letter dog, myasthenic crisis. Okay? Pag myasthenic crisis, guys, ang palatandaan natin dito, too little medication. Okay? Pag cholinergic crisis, ang palatandaan natin, nasagot tayo too little. So ano yung opposite niya? Too much na. Too much medication. And if you would notice, two opposing choices, meron tayo. Isa lang ang tamang sagot dyan. So, second step natin, kapag na-acknowledge natin na, uy, may opposing choices. Okay? Burahin mo na sa paningin mo yung hindi naman related. Yung letter apple, burahin mo na yan. Yung letter C, burahin mo na yan. So, malilito ka na lang, either B and D. Okay, meron din tayong tensilon test na tinatawag. Itong tensilon test na to, or edrophonium test, given to the patients undergoing either cholinergic or myasthenic crisis. Bakit po? Kasi, I6 na pala, guys. O sige, magpapabreak ako pag 50. Okay lang. Okay. Ang presenting symptoms po ng cholinergic crisis, pati na myasthenic crisis, halos parehas lang, mami. So, hindi mo siya ma-distinguish more accurately kung ano ba nangyayari sa kanya. May cholinergic crisis ba siya or may myasthenic crisis ba siya? Okay, and for you to treat that more accurately, kailangan mo mag-perform ng tensilon test. Magbibigay ka ng isang medication. Kapag pinainom mo ang tensilon sa pasyente at na-relieve ang symptoms, is that cholinergic or myasthenic? Cholinergic or myasthenic? Pag pinainom mo yung tensilon, tapos nag-improve, myasthenic. Bakit? Kasi ibig sabihin, nag-underdose ka, binigyan mo na additional dose, nag-relieve. So, too little medication yun. Okay? Pag naman pinainom mo yung tensilon test, actual test yung pinainom, yung tensilon, tapos nag-aggravate yung symptoms, mami, nag-worsen lalo. Okay, ano nang meron sa kanya? Myasthenic or cholinergic? Okay, so this one, kapag na-relieve yung symptoms, and this one, cholinergic, kapag nag-worsen yung symptoms. The other word for your tensilon is your edrophonium. Edrophonium. Pag di nyo po nakita yung tensilon, baka ang ginamit nila edrophonium. Iisa lang po sila. Okay, so 39, that's letter dog. 39 is dog. Number 40, if you're not extra careful and by any chance you give over medication, okay, nasagot na rin natin ito. Okay, 40 letter boy, cholinergic crisis. Okay, nasagot na natin siya, guys. 40 boy. 40 boy, 41, situation, Terry, 25 years of age, unmarried, believes that the toilet for female patients is contaminated with AIDS virus. Okay. And refuses it. AIDS is not a virus. HIV is. Okay. HIV infection na lang sabihin natin. And refuses to use it unless she flushes it 3 times and wipes the seat same number of times with antiseptic solution. The fear of using contaminated toilet seat can be attributed to Terry's inability to, that's letter dog, control unacceptable impulses or feelings. Okay, 41 letter dog. Bakit po hindi letter dog? A boy. Kasi parang tama rin po yung letter boy. Okay, para mas vague kasi siyang isagot. Mas general siyang sagot. Okay, dito tayo sa mas specific na sagot. Okay, 41 letter dog pa rin. Okay, 41, that's letter dog. 42, assessment data upon admission helps the nurse identify which appropriate nursing diagnosis. The patient is having OCD, individual coping. 42, cat. 42, that's letter cat. Isa pa po, number 42 po, letter cat. Coping mechanisms po ang issue niya. 43, effective nursing intervention to help Terry. That's letter C, allowing her to flush and clean the toilet seat until she can manage her anxiety. Hayaan niyo lang po na gawin yung ritual niya. Okay, because as you continuously manage yung overall condition ni patient, eventually, nagde-decrease din yan gradually hanggang sa mawala na rin. So 43, letter cat. 43, that's letter cat. 44, the goal of treatment for Terry must be directed towards helping her to letter C, gain insight that her behavior is due to feeling of anxiety. Okay, 44, letter C. Actually, majority naman ng goals natin sa patients natin with psych conditions for them to develop their insight because kapag they reach that higher level of insight, halos related na rin yan yung compliance to medication, yung change in behavior, yung emotional responses, ganyan. Okay, so 44 letter C. Mas encompassing siyang isagot. 44 po, that's letter cat. Again, number 44 cat. 45. 43 po, that's cat. 42 po is cat. Okay, so 42, that's letter cat. 43, letter cat. 44, cat. 45, psychotherapy is described as letter boy, sustained interaction between the therapist and client to help her develop more functional behavior. Kapag pala psych ang pinag-uusapan natin, I would recommend you to read your Wiedebeck reference. Si Mother Wiedebeck, okay yan as a reference. So 45, letter boy. 45, letter boy. 45, boy. 46, situation. Tom is 38-year-old married man, industrial engineer, was admitted with a diagnosis of paranoid disorder. Okay. He has become more suspicious and mistrustful, and he kept saying, my wife has been planning to kill me. Okay, paranoid si kuya, guy. Okay, so 46, that's boy, projection. Among our paranoid patients, projection and defense mechanism yan. Pinapasa mo sa iba. Okay, yung mga hinala mo. 46, that's letter boy. 47, one morning Tom was seen tilting his head as if he was listening to someone. An appropriate nursing intervention would be letter C, address him by his name to ask if he is hearing voices again. 47, letter C. Assess mo siya. Okay, assess mo. Kung ano yung sagot niya, idepende mo doon yung intervention mo. 47, letter C. 48, he says, these voices are telling me that my wife is going to kill me. It's a therapeutic response by the nurse. That's letter apple. I do not hear the voices you say you hear. Okay, presenting reality. 48, apple. 48, apple. 49, the nurse confirms that Tom is manifesting auditory hallucination. The appropriate nursing diagnosis is letter apple, sensory perceptual alteration. Again, hallucination ng issue. Okay, so ito yung sagot. Pag delusions yung issue, altered thought process. Okay, so 49, that's apple. 49, apple. 50, what is the most appropriate nursing intervention for a client with suspicious behavior? So talk to the client constantly to reinforce reality. Okay? Patients with suspicious behavior, meron silang paranoid delusions, meron silang fixed false belief. And if you would want to try to reinforce yung reality as consistent as possible, okay, over time, okay, mawawala sila sa mundo ng delusion. Okay, mapapasok sila sa world of reality, which is what we want. 50 is letter apple. Do you have any questions so far? So magpa-break muna ako ng 5 minutes. Okay? Break ng 5 minutes. May sasagutin lang akong question dito. Okay guys, sige. So we're down to the last 50 items again. Tsagain na rin natin itong material na to para lang mas maintindihan natin. Para if kayo na po yung mag-isa magre-review na to, alam nyo kung paano siya sasagutan. Balikan lang natin, may nagtanong. 28 letters C, we're talking about your undoing. Okay? 28 letter apple, unacceptable feelings are kept out of awareness by developing the opposite behavior or emotion. Okay? This also means your unconscious blocking. This one is repression. Okay? Kung ang repression ay unconscious blocking, ano naman po yung conscious blocking? Ikaw mismo yung pilit na ayaw mo siyang pag-usapan. Anong tawag doon? Ano to? Okay? Suppression. Correct. Suppression ang tawag doon. Itong letter boy, consciously unacceptable instinctual drives. Yes, correct po, Sir John. Suppression. Are diverted into personally and socially acceptable channels. For example, meron kang sexual preoccupation. Ganyan. Okay? So gusto mo siyang, hindi siya accepted sa society natin. Okay? Gusto mong parang ayaw mo siyang, not really ayaw matanggal, pero nahihirapan kang matanggal yon. So, ang gagawin na lang natin, okay, magpo-produce ka na lang ng isang magandang literature, isang magandang movie, talking about your sexual influences, mga ganon. Ang tawag natin dyan would be sublimation. Okay, dami-dami ko sinabi, nasagutan nyo na pala. Okay, sublimation. Letter dog, transfer of emotions associated with a particular object. Okay? Hindi mo masipa yung anak mo, mami, kahit inis ka na sa kanya. Okay? Ang tawag natin dyan, displacement. Okay? So, yun yung mga defense mechanism. Okay? Sige. So, sa nagtanong po, sana mas naging clear sa atin. Meron na lang din ako, dito ko na lang isisingit. O sige, saan ba yun? Isingit na lang din natin. Sige, dito na lang. Meron tayo mga pre-medications prior to your ECT. The first one, of course, muscle relaxant. Ang recommended sa atin is your succinylcholine. Hindi ko lang alam yung spelling. Succinylcholine. Ganyan ba, guys? Ganyan. Okay, muscle relaxant. Para kapag maiwasan yung pagiging stiff, maiwasan din yung mga possible injuries or fractures ng patient. The next one, magbibigay tayo ng anticholinergic. That's what you call your atropine. Okay. Also to reduce your saliva. Okay, yan produce ng respiratory tract natin. Okay, to avoid aspiration. The next one, magbibigay tayo ng anesthesia. The recommended would be thiopental. Pag di nyo ito nakita, baka ang ginamit nila methohexital. Yan. Okay, mga barbiturates naman natin yan. Okay. Anticonvulsions or anticonvulsants rather, okay, as much as possible, hindi tayo magbibigay kapag mag-ECT yung patient. Kasi mag-i-induce nga tayo ng seizure eh. So kapag nabigay ka ng anticonvulsant, prior to ECT, mas mag-i-increase yung seizure threshold ng patient. May hirapan tayong ma-reach yung gusto nating seizure situation niya. Okay? Seizure situation, basta something like that. Okay? So, yan. So, 32 letters. Balik tayo number 50. Ay. Last na to, guys. Please, kapit-kapit po tayo. Okay? Which of these questions should a nurse ask a patient when po mag-perform ng VS sa ECT? Before and after the procedure? Yes, both. Who is suspected of having acromegaly? Before because, baseline mo. After because, ano yung response ng patient after the treatment? That's one, 51 letter boy. Are you buying larger size shoes? Ang acromegaly po, ika-classify natin to under your endocrine metabolic problems. Med-surg problem po ito. Okay, kung saan lumalaki po yung certain organ or yung body parts ng pasyente. For example, pumahaba yung paa niya or yung kamay niya. Okay, so yung skull sometimes affected din. Okay, and for us to better assess, okay, dapat tama rin yung itatanong mo. That's letter boy. Are you buying larger size shoes? 51 letter boy. 51, that's letter boy. 51 boy. 52, which of the following assessment findings, if identified in a patient who has a short leg cast, would require immediate follow-up by a nurse. So, ang pasyente natin ay may cast. Ano pa? Follow-up by a nurse. So, i-refer daw siya sa doktor. So, that's letter dog, tingling of the toes. Kailan ba tayo magre-refer? Kapag meron tayong possible complications, right? So, this one is a circulation problem. Okay, so 52 letter dog. Perfusion issue, ganyan. Okay, reduced blood oxygen supply, ganon. Okay, so 52 letter dog. 55. Nurse is assessing a patient with fractured femur. The development of fat embolus in this patient would be indicated by letter boy, shortness of breath. Embolus ang patient, sakto kapag naging pulmonary embolus yan. Breast talaga yung affectation. 53, that's letter boy. 54, which of the following nursing diagnosis would be most appropriate for a patient who has a diagnosis of deep vein thrombosis in the leg? That's letter boy, altered tissue perfusion. 54, that's letter boy. 55. A patient has just been hospitalized for treatment of compulsive hand washing. The nurse should intervene if staff members are seen behaving in which of the following ways. Okay, sinusuway mo yung pasyenteng nasa kalagitnaan ng ritual. Okay? Or worse, okay, totally binabago mo yung routine niya. Guys, ginagawa niya yun kasi anxious siya. So kapag if you take away that kind of routine, mas magiging anxious yung pasyente. Baka ma-agitate mo yan. Magpa-panic mode yan. 55, letter boy. 55, letter boy. 56, when assessing a patient who has acquired immune deficiency syndrome or AIDS, which of the following signs and symptoms would be most indicative of AIDS dementia complex? Actually, guys, kaya mo itong masagutan kahit na hindi ka masyadong familiar kung ano ba yung AIDS dementia complex. Okay, neurologic symptoms yan. Okay, so yung mga hindi naman related sa CNS, okay, burahin mo na yan. Okay, letter apple and letter C. And headache, as we know, one of the non-specific symptoms ay ang tinatanong sa atin, most indicative. O, dito tayo, letter C. 56, letter cat. 56, that cat. Okay, 56, that's letter C. 57, which of the following statements, if made by a patient who has myasthenia gravis, would indicate correct understanding of necessary adaptations to the disease? Sabi natin kanina, na ang myasthenia gravis is an autoimmune condition. Therefore, affected din yung immune system capability ng patient natin. That's letter dog. They're very, very prone to have infections. 57, dog. 57, that's letter dog. 57 po, that's dog. 58, the nurse caring for a patient who has had a subarachnoid hemorrhage should be aware that increasing ICP is manifested by, that's letter apple, widening pulse pressure. At the same time, bradycardia or tachycardia. Bradytachy. Bradycardia. Bradypnea or tachypnea. Bradypnea or tachypnea. Bradypnea pa rin. In short, kapag increasing ICP, anong shortcut natin dyan? Hypotachytachy and widening of pulse pressure. Kapag hypertachytachy, the patient is experiencing, probably, nagsha-shock yan, guys. Okay, correct, Ma'am Charmaine. Yan yung difference. So kapag ICP, brady tayo. Okay, so 58, letter apple. 58, apple. 59, hyperactive patient who is on psych unit is changing his clothes in the day room. Ay, sorry. Sorry, hypotachytachy. Ayan. Nalutang. Okay, yan. So I stand corrected. So 59, hypertensive or hyperactive patient, okay, who is on the psych unit, changing his clothes in the day room. Okay, so ang patients natin na medyo manic, guys, we would also want to maintain the dignity and the honor of the patient. Not only yung patient himself, but also yung other patients sa room. Okay? So kapag yun yung ginawa niya, naghuhubad siya sa salaset. Salaset, may salaset yung word. Okay? Papuntahin mo siya sa room niya. Okay? So 59 letter boy. Privacy tayo dyan. 59 letter boy. Privacy. Take him to his room to finish the activity. 59 letter boy. Okay? So 59, that's boy. Number 60, 5-year-old child displays hyperactive behavior after receiving a dose of diphenhydramine Benadryl. The nurse would recognize that. Letter C, typical adverse effect of the drug. Okay, 61. Following pieces of equipment should a nurse have available at the bedside for a patient who is admitted for a exacerbation of Parkinson's disease. Okay, that's letter apple, suction apparatus. Bakit? May respiratory affectation. Neuromuscular problem po ito. Okay, risk for aspiration. So,isuction natin yan. 61 letter apple. Okay, 61. That's letter apple. Nagkaroon ako ng pasyente na merong Parkinson's disease. Okay? Tapos na-comatose siya. Sa tingin nyo guys, eto hindi ko muna i-reveal, pero sa tingin nyo ba, kapag ba ang Parkinson's patient ay na-comatose, may tremors pa rin? Yes or no? What do you think? Pag ang Parkinson's ay na-coma, may tremors pa rin ba siya? What about the others? What do you think? May tremors pa rin. Apparently, okay, may tremors pa rin ang patient with Parkinson's kapag nakoma sila. Pero here's the thing or here's the catch. Depende siya, okay, sa depth ng coma state niya. Okay? Meron kaming patient before, medyo GCS 7 or 8 pa siya, may tremors pa rin. Pero once he reached GCS 3, totally nawala yung tremors bigla. Kaya at that state, okay, yun nakuma siya tapos may tremors pa rin. Nalito kami kung paano mag-GCS. Nakakaloka. Pero kasi we have to analyze the situation of the patient. Dapat yung baseline ng patient nandoon para mas accurate din yung pag-GCS natin sa patients. Okay. Ayun, share ko lang. Na-amaze din ako nung nalaman ko yon na nagtitremors pa rin kapag nakoma. Pero kapag deep coma state, doon nawawala yung tremors nila. Okay, so 61 apple. Kamusta yung grandfather mo, ma'am? To which of the following nursing actions would a nurse give priority to a emergency care of a patient who has sustained a compound fracture of the patient? Okay. So masaya na po siya. Okay. Rest in peace na po. Okay, 62, that's letter apple. Sprint talaga in its present position. Bakit po neutral alignment? Kunwari, nadatnan mo yung patient, okay, nakabaliko na yung limbs niya. Okay? As is mo siya, okay? As is mo siya to prevent further injuries. 62, letter apple. 62, letter apple. 63, patient who has a Kaposi sarcoma has all of the following nursing diagnoses. To which one should the nurse give priority? That's letter dog. Hopelessness related to inability to control disease process. If a patient, na HIV patient, nagkaroon siya ng Kaposi sarcoma, ay natabunan, ma'am, pero nasagot ko na siya. Okay, isend ko na lang ulit. Hypo po yan. Hypo. Yan. Kapag ang patient mo na may HIV, nagkaroon siya ng Kaposi sarcoma, we would also like to imply, okay, na baka AIDS level na siya. Medyo more severe form na yung HIV state niya. Okay, and with that kind of state, okay, patients would inevitably have the hopelessness case. That's 63 letter dog. Okay, 63. letter dog. 64. Atong klaseng situation na to, hindi lang siya exclusive sa AIDS patients natin. Actually, yung mga terminally ill patients natin, they would also suffer or experience that hopelessness. Which is very, very valid naman. We just want to be there and acknowledge the fact, diba? Yung support dapat nandyan pa rin. Yung maintenance ng comfort, honor, dignity rather, dapat na bibigay pa rin natin sa patients natin. Okay, so 64, nurse is providing care to a patient who has balanced skeletal traction applied to the femur. Which the following findings require immediate nursing intervention? That's letter boy, the traction weights are resting on the bed frame. In fact, guys, the weights should hang freely. Sulat ko lang dito. Weights should hang freely. At the same time, kung gusto mong kalikutin yung weights ng skeletal traction, it requires a doctor's order. Okay, hindi mo siya basta-bastang gagalawin kapag wala kang doctor's order. So 64, that's boy. 64, that's letter boy. 65, nurse observes a nurse's aids, taking all of the following actions when caring for a patient who is in balanced skeletal traction. Which action requires further discussion by the nurse? Pag ito na naman yung lumabas na question, ibig sabihin may maling ginawa or may mali kang nakita. That's letter dog. Removing the weights when positioning the patient. Again, to re-emphasize, the weights should hang freely. Weights should hang freely. Yan, 65, letter dog. 65, letter dog. 66, a woman who has type 1 asks the nurse, how will this pregnancy affect my insulin needs? Okay, that's letter dog. Increase during the 3rd trimester. Nakakatawa na med-surg itong question na to. Tapos bigla ka nag-UB question, 66 letter dog. Tapos bumalik ka ulit sa med-surg question ulit. Napaka-random naman nun. 67, low back pain to the nurse. I feel the pain down to my ankle. Which of the following actions would the nurse take first? Again, guys, take first ulit. So nursing process ulit tayo dito. Assessment takes first. 67, letter cat. 66 dog. 66 is dog, 67 is letter cat. Baka may nako-compress na pala siyang verbs. Okay, assess mo muna. 67 letter C. 68, which of the following statements, if made by a patient who had a total hip replacement, would indicate to a nurse that the discharge stitching has been effective? Okay, that's letter dog. I will need to make my toilet seat higher. Bakit po? Patients who underwent total hip replacement. Okay? Isa po sa nursing education natin towards, yes, those kinds of patients. Ayaw natin ng mga bending positions. Iniiwasan natin yan. Okay? So, ang tendency, dapat bumili na lang sila ng toilet seat na mas mataas para to reduce the bending episodes. Bending episodes, bending positions. Okay? Nila. So, 68 letter dog. 68 letter dog. Okay, number 69, which of the following statements, if made by a parent of 18 months old, experienced 2 episodes of febrile seizures is accurate? Guys, highlight ko to, 18 months old. Highlight ko rin ito, febrile seizures. Okay, ma-outgrow niya yan. Okay, ma-outgrow niya yan, especially with the type of seizure that he has, febrile seizure. Okay, so 69, that's letter C. Okay. Yes, ay oo. Ito yung under 5 seizure na tinatawag, febrile seizures. Okay, 70, which of the following statements would the nurse include in the pre-op instructions for a patient who is scheduled for an ileostomy? Letter C, you will have a NGT after surgery. 70, letter C. 71. Following findings would be the earliest indicators of fluid volume deficit. Okay, whether or not alam mo na yung technicalities ng percent dehydration na yan. Okay, alam natin na magiging tachycardic yung patient kapag nagde-dehydrate na siya as a compensatory mechanism. 71 apple. 71, that's letter apple. 72, laboring woman's husband assists her during the transitional phase of labor. Transitional phase, guys. So, ano to? Possibly, mafufuli na siya dito. Magte 10 centimeters na yung cervical dilatation niya dito. Right? Which of the following behaviors, if exhibited by the husband, would require intervention by a nurse? That's letter apple. Offers a woman a bedpan when she says she needs to have a bowel movement. In fact, guys, kapag ang pasyente natin, sabihin niya sa atin, uy, nurse, feeling ko po na dudumi po ako or nadjejebs po ako, i-check mo kung may bulging head na ba sa perineum area ni mother. Baka lumalabas na si baby. Baka fully na siya by that time. Ferguson reflex. Okay, so 72, that's letter apple. Okay, 72, apple. Ang cute-cute ng ganitong husband na gusto niya makatulong pero hindi niya alam kung paano. But either way, thank you for the effort. Parang ganon. Yan, 72 apple. 73, which of the following actions should a nurse take during the pre-interaction phase of the nurse-patient relationship? Uy, guys, pre-interaction. Okay? Hindi pa kayo nagmi-meet ng pasyente, guys. Okay? So, ano yung mga ginagawa natin sa buhay pag ganyan? Self-awareness muna. Bakit? I-assess mo muna yung sarili mo. Meron ba akong stereotype or stigma towards these kinds of patients because it could affect my nursing care na ibibigay ko sa kanya. So that's letter apple. Exploring personal feelings regarding care of the mental health patient. Okay, 73 apple. And the more you understand about the patient's condition, the better care na ipoprovide natin sa kanila. 73 apple. 73 apple. 74. Following factors, if noted in patient's history, would predispose the patient to development of diverticulitis, letter C, that's low fiber diet. Okay, low fiber diet. Ano itsura nitong diverticulitis na to? I-highlight ko nga. Meron kang bulging pouches. O yun yung keyword natin, ha? Bulging pouches. Nagkakaroon ng pockets yung intestine natin. Tapos doon na sumisiksik yung mga residues. Okay? So, yun yun. Kasi low fiber diet, more prone to constipation tayo dyan. 74, that's cat. Okay, so natatrap kasi doon yung mga natitirang food. 75, which is the following findings. Magsamgyup. Mga mahilig daw magsamgyup dyan, guys. Yan. Would the nurse expect to assess in an elderly patient who has urinary retention? Okay, pag sinabi mong hesitancy of urination, ibig sabihin nun, not necessarily meaning na hindi nila nafe-feel. In fact, nafe-feel nila, na naihi sila. Okay, but they hesitate, okay, to release that urine. Nag-hesitate sila na pumunta sa CR. So, anong tendency nun? Maipon lang sila sa loob ng bladder. Yun yung urinary retention na tinatawag. So, 75 letter boy. Guys, okay pa ba tayo? Konting-konti na lang po. Umuunti tayo, guys. Umuunti rin naman yung questions. Di ba? Ilaban na natin to. Okay? Guys, kumapit kayo, guys. Take my hand. Yan. And we'll fly. Yan. 75 letter boy. 75 letter boy. Guys, laban-laban tayo to top the board exam. Heart sign. Patient is newly admitted to the psych unit with a diagnosis of bipolar disorder manic phase. Which of the following activities would be most appropriate for the patient? So magkasundo na tayo, guys. Okay? Frequently occurring itong klase ng questions. Patients with manic phase. Okay? Or is under the manic phase. Anong klaseng activity yung ibibigay natin sa kanila? Of course, dapat uncompetitive or non-competitive. Okay? Non-competitive activities at the same time, solitary activities, mag-isa lang siya. At the same time, productive activities. Ganyan. Yung mga keywords na hanapin natin, guys. Non-competitive, solitary, productive. For example, guys, ang pasyente mo na manic patient, pinasali mo sa basketball, tapos natalo sila. Okay, di nag-agit yan. Tapos nag-agit, ubos tayong lahat dito. Okay, wala na. Okay? Kapag naman po, solitary, mag-isa lang siya, okay? Yun yung mga tipo magtitiklop lang siya ng mga sinampay, ganun. Productive yon. Etong letter dog, work with modeling clay o medyo as artistic expression tayo dyan, okay lang yan. 76 letter dog. Ito naman pagkahirap-hirap naman ng crossword puzzle, Diyos ko naman, solitary activity, pero napakahirap naman. Okay, mas ma-agit siya dito. So ayaw mo rin naman tong ipagawa sa kanya. Okay, letter dog tayo. 76 is dog. Etong letter boy, ayaw matapos, ayaw tumigil. Reading quietly in his or her room. Manic pace siya, guys. In the first place, hindi niya kaya yan. Okay? Yan. Hindi niya kaya yan. Nagpapanggap lang siya dyan. Okay? 76 letter dog talaga yung sagot. Ito, this one, competitive yan. Ganun. 76 letter dog. 77. Which of the following actions should a nurse include in the planned care for a patient who has water intoxication? Measure urine-specific gravity. Okay. Can you give me a value or a range for a normal urine-specific gravity? Para malaman natin kung water intoxicated na ba siya or dehydrated ba si patient, ano yan? Nasabihan ko na ba kayo guys, na kapag mag-aaral kayo sa laboratory values, as much as possible, isang reference lang yung babasahin ninyo. Okay? Because different references would say otherwise. Para hindi ka malito, isa na lang yung pagbasihan mo. Hindi lang naman sila nagkakalayo. Okay? Pwede natin sabihin 1.010. Sige, gamitin natin yung sinend ninyo to 1.030. Okay? Which is which? Kapag mas malayo siya sa 1 flat, is that water excess or dehydration? Kapag sabihin natin 1.5, yung urine specific gravity niyan, dehydrated or excessive water? Hindi naman kayo, uniform. Okay? The farther you are to 1.000, the more dehydrated you are. Okay? Mas mataas ang value ng urine specific gravity, mas dehydrated ka. Okay? So 77, letter apple. 77 is apple. Number 78. Patient who has undergone surgery for creation of ileal conduit is scheduled for discharge. To determine if the patient will be able to self-care manage at home, a nurse would assess the ability to, letter boy, change the stoma appliance. 78, letter boy. And if the patient is capable of changing his or her own stoma appliance, it also indicates the patient's acceptance, okay, towards his or her current situation. Na meron na siyang ganito, ileal conduit. 78, letter boy. 78, letter boy. 79, it is suspected the patient has a stone in the ureters. Which of the following manifestations would help a nurse confirm the diagnosis? Pain radiating to the groin. Kung nasan yung area o yung level ng stone na yon, andun yung pain. 79, dog. 79 is dog. 80, which the following manifestations would be the most significant when assessing a woman for evidence of true labor? Napaka-random naman itong OB question na to. Para po sa tayo sa NP5, dun lang siya lumilitaw. Letter boy, progressive cervical dilatation. Kapag yan ay tumungtong ng 10 centimeters, huli na si mother. Yan, nag-aagawa na tayo ng case dyan. Parang, uy, nakatatlo ka na ako naman. Ganyan. 80, letter boy. 80, that's letter boy. Last number 20 items. Guys, please stay with me. Kayang-kaya natin to. Which of the following questions would be most important for a nurse to ask when taking history from a patient who is suspected of having multiple sclerosis? Ito, multiple sclerosis na to, guys. Ano feature niya? Neuromuscular din ito. Okay? At the same time, meron siyang key feature of it having being a relapsing and remitting, okay, type of disease. So, pwede siyang lulubog lilitaw, yung disease na yon. And itong multiple sclerosis, multiple organ ang affectation nito. Most especially visual disturbance. Asan yan dito? Letter boy. Okay, visual disturbance issue tayo. 81, that's letter boy. 81 is letter boy. 82, which is the following nursing measures, would be included in the care plan for a quadriplegic patient who is receiving bowel training. Letter dog, performing rectal digital stimulation. Taking note of the fact that itong quadriplegic patients natin, usually ano yan, incontinent yung mga yan. Okay, so gusto mong gawin yung letter D. Okay, when that certain patients would undergo bowel trainings. 82, letter dog. 82, letter dog. 83, when providing care to a patient who has returned to the unit following a cerebral arteriogram, a nurse would give priority to which of the following nursing interventions? Dito po sa cerebral arteriogram, may gagamitin ba tayong contrast dye dito? May dye ba tayong gagamitin dito? Cerebral arteriogram. Okay? So yes ang sagot. Okay? Basta nakita mo yung word na arteriogram, arteriography, ganyan. Okay, may contrast dye tayo dyan. Okay? So dapat assess mo muna, baka may allergy siya. Sa shrimps, ganyan. Okay, you would give priority, that's letter dog. Maintaining a pressure dressing over the insertion site. Siyempre, magpa-puncture po tayo dyan. Very, very prone to bleeding. Assess for bleeding. 83, letter dog. 84, which of the following nursing measures would best promote communication between a nurse and a patient who has expressive aphasia? That's letter boy, pointing to a picture board. Okay, so 84, that's letter boy. Pag sinabi mo expressive aphasia in comparison to your receptive aphasia, okay, i-highlight ko po. Ayan. Pag sinabi mo expressive aphasia, alam mo kung ano yung gusto mong sabihin, hindi mo lang ma-verbalize, hindi mo lang siya ma-express. Okay? So kabaligtaran naman, receptive aphasia. Okay? Naririnig mo yung patient, but it could affect your ability to understand other people. Yun yung pinagkaiba ng expressive tsaka ng receptive. Okay? Ayan. So 84, that's letter boy. 82 po, that's letter dog. 83, letter dog. 84, letter boy. 85, nurse is observing a patient who has water intoxication. Which of the following assessments should the nurse make to determine if the patient is following the plan of care? Letter apple, daily weights. Okay, daily weights. 85, apple. At the same time, using the same clothes. Okay. 86, client who was diagnosed with undifferentiated schiz, admitted to the unit because of increasingly severe mood swings. His diagnosis is changed to schizoaffective disorder. He asks the nurse, so now what? My risperidone is just not doing the job. How should the nurse respond? Na-curious ako bigla. Yung batch nyo ba guys, nag-duty sa sa ward 7, mental ward, psych ward. Nag-duty ba kayo sa psych ward? Yung iba. Psych institution. Hindi kayo nag-duty sa Ward 7? Ay, sorry. Sa mga taga-UP, wala. Yung iba, hindi rin sa ibang schools. Inabutan ng pandemic. So, ano exposure niya doon? Online, psych ward. Paano online psych ward? Parang hypothetical situations, ganun. Hypothetical? Okay. All right. Sige. Yung iba virtual. Okay. Sige. We do the best that we could kapag ganun. Yung iba hypothetical. Patient sarili. Pwede rin naman, visit for a day for the Ward 7. Okay din yung style nila kung hindi talaga kaya para lang makita nyo or ma-feel nyo yung feel na nasa Ward 7. Ayan. Telenursing. Okay. So, okay rin yung style ng nursing ng mga colleges ninyo. Kasi mas okay talaga kapag may exposure. Pero di rin naman kasi natin pwedeng ipilit kasi safety ninyo yung mako-compromise. So, ayun, bawi na lang tayo sa actual duty natin if you would want to be at the hospital site or bedside. Okay. 86, super fun sa psych ward. Gusto lang i-share. 1 month kami doon. Tapos yung first 2 weeks, nagkwento, yung first 2 weeks, ang patients namin, yung mga bantay. Hindi yung actual patient. Tapos the last 2 weeks, ang patients namin, yung actual patients na. Tapos sobrang fun kasi, especially sa patients with bipolar, sobrang na-appreciate ko yung manic phase nila, tsaka yung depressive episode. It's really true. Okay? So yung mga mental health illnesses natin, totoong-totoo yun. Guys, hindi siya dapat dinidismiss, hindi siya dapat parang binabalewala. Okay? Yung mental health illnesses natin is equally important as our physical health illnesses. Ayan, gusto ko lang i-share. Okay? Pavilion po tawag namin. Ano yung pavilion? Ayan. 86, letter boy. With your mood swings, you may need to take a mood stabilizer along with Risperdal. And if you would notice, pavilion, if hindi siya medyo nabanggit ng prof ninyo during sa word, okay, I see. At tawag ito, kung hindi siya masyadong na-emphasize ng prof ninyo during your college times, gusto ko ring i-share yung fact na kapag nasa mundo tayo ng psych, we're not really so much focused about the diagnosis itself. Okay, mas gusto nating pag-aralan yung behavior nila. Bakit? Kasi from time to time, napakabilis lang mag-shift ng mga diagnosis ng pasyente. Sa isang week, schizoaffective siya. The next week, ibang klaseng schiz na siya. Okay, kaya kapag nag-aano tayo, anong tawag doon? Yung ita-transcribe natin yung napakahabang ginagawa natin, ita-transcribe yung pinag-usapan natin. Ganon. Basta yung tawag doon. Hindi tayo masyadong process recording. Hindi natin masyadong focus yung diagnosis. Yon, correct. Thank you. Yan, process recording. So, 86 letter boy. 86 letter boy. 87. A client who is neatly dressed and clutching a leather briefcase tightly in his arms scans the adult inpatient unit on his arrival at the hospital and backs away from the window. The client requests the nurse that the nurse move away from the window. Kumbaga, nasa malayo daw siya. Tapos sinabi ng client sa'yo na, uy, umalis ka dyan. Parang ganon. Okay, the nurse recognizes that doing as the client requested is contraindicated. Let me highlight this statement for you. Guys, for which reasons? Letter boy, the action indicates non-verbal agreement with the client's false beliefs. Alam natin, whichever the client's diagnosis is, basta psych patient, they have a tendency to manipulate the people around them. Let me write that. Okay, very, very prone to manipulation yung mga yan. Okay, ikaw as a nurse, minsan hindi mo na napapansin na namamanipulate ka na rin pala. And for you to avoid that manipulation episodes, okay, wag ka namang sunod-sunod lang sa pasyente. Okay, kung anong gusto niya masusunod, hindi ganon. Dapat ikaw pa rin. You still need to assert your authority, okay, as a nurse. Okay, so 87, letter boy. So kapag lumayo ka nga sa window, para mo na rin siyang sinunod. Okay, di nagpa-manipulate ka na sa kanya. 87, boy. 87, that's letter boy. 88, uy, konting-konti na lang, guys. Client reports having thoughts of being followed by foreign agents. Ay, ang taray. Humabol pa sa paghugot si Mom. Okay, or after his secret papers. Which response by the nurse is most appropriate when responding to the client's disturbed thought processes? Letter boy, I think these thoughts are frightening to you. Okay, 88, letter boy. Okay, 88, letter boy. Kapag ganito, na nag-share, okay, ng beliefs or nung nararamdaman yung pasyente, as a nurse, as a psych nurse, mas gusto natin na mas mag-focus tayo towards the feelings of the patient. Yun yung explore natin further. Okay, 88, letter boy. 88, letter boy. 89. The nurse is assessing a client who is taking an antipsychotic medication. Which of the following symptoms is uniquely indicative, okay, for neuroleptic malignant syndrome? That's letter apple, very high temperature. Okay, very high temperature. Ano bang nangyayari dyan? Mga EPS natin, di ba? Emergency situation pag neuroleptic kasi Ano nangyari? Febrile episodes, meron ka na dyang mental status changes, mga ganyan. So, 89, apple. Rigidity, yan. 89, letter apple. Number 90, client diagnosed with undifferentiated schiz gained 50 pounds. 50 pounds in 6 months while taking olanzapine after seeing her psychiatrist who changed the medication to ziprasidone. Tells the nurse, I don't want to take this Giodon either. I can't gain any more weight. Anong klaseng response daw yung sasabihin natin sa patient? That's letter apple. Okay? Giodon causes less weight gain than other atypical psychotics, antipsychotics. Sino ang mas maraming extrapyramidal symptoms? Atypical or typical antipsychotics? Mas maraming EPS. Ayaw nga natin ng masyadong maraming EPS. So, hindi natin siya masyadong ipaprescribe. Okay, so that's your typical antipsychotics. Ang olanzapine, typical and atypical? Typical, atypical, olanzapine. Atypical, correct. Itong Giodon, ziprasidone, typical or atypical? Atypical as well. Along with your clonidine. Lagi anti-hypertensive, your clozapine rather. Along with your clozapine, your risperidone. Diba? Ito yung mga frequently na pre-prescribe kasi lesser EPS to. Okay, quetiapine. Alam mo bang napakalakas ng quetiapine, guys? Kapag nagpe-prescribe kami ng quetiapine, 1/4 lang nung tablet. Okay? Tulog yung pasyente. Tulog agad. Okay, yung mga atypical antipsychotics natin. Okay? Actually, aripiprazole, you heard or hear about it. Okay? Ayan. Atypical yan. Lorazepam, parang first time ko lang siya marinig. Search natin. Lorazepam. Lorazepam. Antipsychotics din siya. Okay? Atypical. Okay, lorazepam is atypical then. Second generation. Okay, so 90 apple, 91, 79-year-old woman by her daughter for a routine medical evaluation. Sabi ng daughter niya, mother is quite stable and has no adverse effect from the risperidone she is taking. Then the daughter says, I just think my mother could be even better if she was on a larger dosage. Ito na yung mga pala desisyon na family members na medyo nakakainis na. Kapag ito yung mga kasama natin, okay, sa ward. My son takes 1 milligram of risperdal every day and my mother is only 0.5 milligrams. Minsan meron mga pasyente na hindi naman toxic. Mas toxic yung mga bantay. Mga ganon. What is the most helpful response by the nurse? That's letter C. Older clients generally need only 1/3 to 1/2 the dose of younger people. Okay, 91 letter cut. True po, di ba? Alam natin yan, guys. 91 letter C. Especially, nahihirapan na yung organs ng patient natin, elderly patient, to metabolize the drugs that we're giving to them. So 91, that's letter cut. 92, which action by the nurse is likely to increase the anxiety and suspiciousness of a client who is delusional. Mami, magbulungan daw ba sa harap ng pasyenteng may delusions? Okay, paranoid delusions. Wag ganon. Okay, 92, letter boy, whispering with others. Okay, wag ganon. Okay, 92, that's letter boy. O, mas respectful tayo, wag po ganon. Yan. 92, that's letter boy. 92, that's letter boy. 93, client with undifferentiated schiz tells the nurse that he doesn't go out much because he doesn't have anywhere to go and doesn't know anyone in the apartment where he's staying. Which of the following actions is most beneficial for the client at this time? That's letter dog, arranging for the client to attend day treatment at the clinic. Okay, 93, that's letter dog. Okay, para may purpose siyang lumabas. Pa-outpatient mo na lang siya. 93, that's letter dog. 94, client with chronic schizo has positive and negative symptoms, but does not meet the criteria for paranoid, disorganized, or catatonic skits. Based on the interpretation of this information, the nurse should expect the client to exhibit which of the following as the most likely symptoms. Okay, we're talking about your undifferentiated schizophrenia. Okay, that's letter apple. Auditory hallucinations and asocial behaviors. Ayan. Ang auditory hallucination, ano to? Positive symptom yan. Ang asocial behavior, negative symptom yan. Okay? Itong letter boy, preoccupation with persecutory delusions, edi paranoid skits. Itong letter C, grossly disorganized behaviors and speech, edi disorganized skits. Itong letter dog, immobility and waxy flexibility, edi catatonic schizophrenia. Wala tayong choice. Letter apple ngayon sagot. Okay? 94, apple. 93, letter dog. 93, letter dog. Ipa-outpatient na lang natin yung treatment para may reason siya lumabas. 93, dog. 94, apple. 95, plan of care for an outpatient client with chronic and differentiated skits includes risperidone. The nurse prepares to administer this drug based on the understanding rather of which of the following. That's letter boy. A granulocytosis is less of a risk with risperidone therapy. Bakit po? Kasi atypical antipsychotic medication ang risperidone. 95, that's boy. 95, letter boy. 96, the son of an elderly client has cognitive impairments, approaches the nurse and says, I'm so upset. The physician says I have 4 days to decide on where my dad is going to live. The nurse responds to the son's concerns, gives him a list of types of living arrangements, discusses the needs, abilities, limitations of the client. Grabe yung nurse na to. Okay? Very out of the way talaga. The nurse, to help, no, should intervene further if the son makes which comment. Okay? So, i-highlight ko lang ito, intervene further. Ibig sabihin, may something wrong sa nasabi ng anak ng pasyente. Letter dog, I want the social worker to make this decision so dad won't blame me. Okay? Ikaw yung next of kin. Ikaw yung anak, ikaw mag-decide. Ano ba naman ang malay ng social worker dyan? Okay, 96, letter dog. Dapat i-involve mo rin yung sarili mo sa care ng patient. 96, that's dog. 96 is dog. 97, the nurse observes a client in a group who is reminiscing about his past. Which effect should the nurse expect reminiscing to have on the client's functioning in the hospital? Let's letter C, decrease the client's feelings of isolation and loneliness. Okay, 97, letter C. Actually, hindi lang naman to applicable sa mga psych patients natin. Kahit tayo, aminin natin, di ba kapag nalulungkot tayo or nabobored, ganyan, wala tayong magawa sa kwarto. Okay, nagre-reminisce lang tayo ng mga nangyari sa past. So, nag-smile-smile tayo alone. Mga ganon, mga gawain natin. 97, letter C. Tapos masaya ka na ulit. Ganon lang. 97, that's letter cat. 98, 69-year-old client admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, unlock this door. I've got to see, okay, my doctor. I just can't miss my monthly Friday appointment. Which of the following responses by the nurse is most appropriate? Okay, present reality. Letter boy. It's Tuesday and you are in the hospital. I am a nurse. 98, letter boy. Okay, 98, letter boy. 99. The nurse is attempting to draw blood from a woman with a diagnosis of delirium who was admitted last evening. The client yells out, stop, leave me alone. What are you trying to do to me? Okay, what's happening to me? Guys, whether or not subjective or objective cue yung binigay sa atin, i-highlight mo pa rin. Which response by the nurse is most appropriate? That's letter apple. The test of your blood will help us figure out what is happening to you. Okay, hindi porket psych patient yung kaharap mo. Okay, hindi mo na yan bibigyan ng health education. I-explain mo pa rin kung ano ba yung ginagawa mo sa kanya. Okay, it would also reduce his or her anxiety. 99, letter apple. Last number. Magpa-break kaya ako. 7:20 pa siya. Last number. Okay? The client with diagnosis of borderline personality This order tells the nurse, you're the best nurse here. I can talk to you and you listen. Ayan na po ang manipulation strategies niyan. You're the only one here that can help me. Which of the following responses by the nurse is most therapeutic? Letter boy, all of the nurses here provide good care. Huwag mong i-single out yung sarili mo. Okay? Kasi kapag sinabi mong thank you, pag nag-thank you ka, in-acknowledge mo yung statement niya. Nagpa-manipulate ka na sa kanya. Hawak ka na niya ngayon. Okay? Nagpauto ka sa kanya. Unlike number 100, letter boy, mas objective ito. Okay? Generalized mo. Yon, yung mga staff members sa word. 100, letter boy. Do you have any questions? Okay. Urine specific gravity. So that's 1.010 to 1.025. Minsan ibang references 1.030. Questions, guys. Clarifications. Violent reactions. Kung mapapansin ninyo, hindi ako nag-in-depth na discuss ng mga concepts because leveling of expectations, ibalik ko lang yung first slide. Okay? Pre-intensive phase exam ratio. In-expect ko, okay, na hindi pa naman kayo ganun kahimay sa mga concepts. So hindi ko na rin kayo binombard ng mga konsepto because ayoko na rin i-spoil yung experience na mafe-feel ninyo or ma-experience ninyo towards your intensive phase lecturer. So gusto ko ma-enjoy nyo yung pag-unlock, yung pag-discover ng bagong knowledge or existing knowledge that you may have. Okay? So guys, if you don't have any more questions, alam kong maaga pa po kayo nagsimula. Oh, sorry. Last na to. Question. If may kaso po na ibibigay sa healthcare provider, if nag-sign, tapos going resuscitate pa rin, meron siyang legal violations, malpractice, pwedeng under malpractice yon. Okay? Or breach. Breach ng contract. Contract yun yung DNR. Okay, so balik po tayo. Okay na po tayo doon? Ayan. Thank you so much po in spending your Tuesday afternoon with me, guys. Sana po marami po kayong natutunan. Okay? Pahinga na po tayong lahat. Ayan. To top the board exam, guys. Thank you so much. Bye, guys. Thank you. Ingat po tayong lahat. Ingat po tayong lahat, guys. Bye-bye. Good night. Good night. Ang aga pa. Yan, mag-dinner na po tayo. Thank you.